Good evening, everyone. Welcome to the Nagara National Seminar Paper and Poster presentation. I would like to invite our paper presentation coordinator, Dr. Aishwarya RS. Dr. Aishwarya, please unmute, Doctor.
Hello, Dr. Sabin. Hello, Dr. Sabin. Am I audible?
Yes, Dr. Audible. Unmute, Doctor.
Thank you, Doctor. A very warm good evening to one and all gathered here. Again, we join together to flourish our knowledge of each other. Hopefully, all of you are doing great. It's my pleasure to welcome all the participants here, and your active participation is valuable for making it a success. Ayurapta delightfully welcoming all of you to Nagara National Seminar with paper and poster presentation. On behalf of Team Ayurapta, I'm privileged to welcome all our esteemed faculty members who guide us to organize this presentation. So first of all, I would like to invite our Agatantra panel, Dr. Srilakshmi SG, Dr. Veena L, and Dr. Shankaraj. Next, I invite our Panchakarma panel, Dr. Rajanisha K, and Dr. Pramila, and Dr. Sukanya S. Next, I would like to invite Dravyaguna panel, Dr. Bindu Pillai, Dr. Sridevi, and Dr. Shrija. Now let me invite Kaumari Pritya panel, Dr. Shrija Ashok, Dr. Ramya, and Dr. Ansiba. Now I invite Samhita panel, Dr. Veena Vijay, Dr. Rashmi H, and Dr. Krishna Priya C. Let me invite our Dintana panel, Dr. Srilata Soman, Dr. Nitya R, and Dr. Arya K. Now I invite Prasuddhitantra panel, Dr. Kumari Velayudan, Dr. Kavita, and Dr. Ashwani K. Now I would like to invite Swastavritta panel, Dr. Indira Menon, Dr. Shilpa, and Dr. Kirti. I invite Kai Chikitsa panel, Dr. Madhavan, Dr. Vinita S, and Dr. Surya Chetak. Now I invite Manasika panel, Dr. Nitin Darade and Dr. Umar Jadhav. Next, I invite Shalyatantra panel, Dr. Vaishak MN, Dr. Ravinder Singh, and Dr. Pratibha Somaraja. Let me invite the Sambhaishija panel, Dr. Arulal K and Dr. Preeti. And I invite Shalakyatantra panel, Dr. Krishna Prabha, Dr. Devika Pratap, and Dr. Revati Raghu. Now I invite our Kriya Sharira panel, Dr. Kiran Kumarti and Dr. Ramya. And finally, I would like to invite a Rajana Sharira panel, Dr. Roshni Rakha, Dr. Ramya Bhushan, and Dr. Divya Prabhaji. Now let's jump on to the session. And before that, I would like to remind the rules and regulations that should be followed during the presentation. Dear participants, the maximum time period for your presentation is 8 minutes. And next, the presentation will be live on YouTube and the copy saved in broadcast. So don't unmute unnecessarily. So now we can start with the first presentation. And first we have a paper presentation. And let me call upon Dr. Needu Singh. I invite Dr. Needu Singh. Okay, next I invite Dr. Jayanth BS for the paper presentation. Dr. Jayanth.
Ma'am. Good evening, ma'am. Hello.
Good evening, doctor. You are audible.
Yeah, ma'am, audible. Hello.
Hello, doctor. Please share the screen, doctor.
Yes. Sir. Share, sir. Once. Can you share, sir?
Okay, 1 second, doctor.
Okay.
Hello, Dr. Jayanth.
Sir. Hello.
1 second, doctor. I will share for you, doctor.
Okay, sir.
Doctor, please start the session, doctor.
Okay, sir. Good evening to one and all. Myself, Dr. Jayanth, first year PG scholar, Department of Shalya Tantra, Sri Kalabareshwar Ayurvedic Medical College, Bangalore. My topic is Welcome to you all a Nagara National Seminar of 2023. My topic is Disease of Spleen, paper presentation under the guidance of Dr. Vishwanath Sir, Shailaja Ma'am, Professor, HOD, Department of Shalya Tantra, SKMCH, Bangalore. Contents: Anatomy and physiology, congenital abnormalities, disorder of spleen, disease of spleen, symptoms, physical examination, investigation, diagnosis, indication of splenectomy, complication of splenectomy, treatment, conclusion. Anatomy and physiology. Spleen is an intraperitoneal organ situated in left hypochondric region of abdomen. It plays laterally to and beyond the stomach just above the left kidney in mid-axillary line. Its upper margin rests against the dome of diaphragm. 9th, 10th, and 11th rib protects the organ. It is purple in color. It is an organ of lymphatic, hematologic, and reticuloendothelial system. It varies in size, shape, usually 12 cm long, 5 cm thickness, 7 cm wide. Splenic hilum found in the inferior middle aspect of gastric imprint. The hilum contains nerves, vessels, and attachments for splenorenal and gastrosplenic ligaments. It stores and filters the blood and makes a WBC that protects the body from infection. Blood supply from splenic artery, branch of celiac trunk, nerve supply from splenic nerve. It has two surfaces. Diaphragmatic surface leans on the adjacent part of diaphragm. Medial surface shows three impressions. Colic area is the impression of left colic fracture. Gastric area, impression of stomach. Renal area, impression of left kidney. It has three borders. Superior border bounds the gastric area, inferior border bounds the renal area, anterior border bounds the colic area. It has 4 ligaments: gastrosplenic ligament, colicosplenic ligament, prenocolic ligament, and prenosplenic ligament. Splenic parenchyma. It is a highly vascular splenic pulp, as a red pulp and white pulp. Red pulp, it contains the venous sinus and splenic cord. It filters the blood. It removes the waste from the blood and gets rid of old or damaged blood cells. Red pulp also destroys the bacteria and viruses. White pulp contains the type B and T cells, lymphocytes, plasma cells, and macrophages. As a part of immune system, the white pulp produces the white blood cells. These blood cells makes antibodies which fight against the infection. Functions of spleen: stores the blood, filter the blood by removing the cellular waste and getting rid of old or damaged blood cells, make a white blood cells and antibodies that helps us to fight against the infection, maintains the level of fluid in our body, produces antibodies that protects us against infection, reserve of platelets. Congenital abnormalities: accessory spleen, they can found near the hilum of spleen, tail of pancreas, splenic ligaments, or in mesocolon. Splenic agenesis is rare. Polysplenia, it occurs due to the failure of splenic fusion. Wandering spleen is due to loose ligament. Ameratoma is a small mass of 1 centimeter in diameter. Disorder of spleen: splenomegaly. It is an enlargement of spleen that is 2.5 times its normal size to become apalpable. Evidence: enlargement of spleen, presence of predominant left-sided abdominal distension if massive splenomegaly. Splenic mass moves downwards on inspiration. Splenic notch is felt on anterior border. Left abdominal pain presents if massive splenomegaly. Types of splenomegaly: massive splenomegaly seen in malaria, Kala-Azar, chronic myeloid leukemia, extrahepatic portal hypertension. Moderate splenomegaly: Hodgkin's, leukemia, lymphoma. Hematolytic anemia, biliary cirrhosis, tumors, cyst, and tuberculosis. Mild splenomegaly, acute infections, typhoid, septicemia, thrombocytopenic purpura, acute splenomegaly, acute infectious fever, typhoid, malaria. Injury: hematoma, rupture of spleen. Vascular causes: splenic infarct, thrombosis of splenic vein. Connective tissue disorders: rheumatoid arthritis, SLE, Plattis syndrome, Still disease, tumors, and cysts. Hypersplenism. Definition: it is an indefinite clinical syndrome that characterized by the splenic enlargement associated with anemia, leukopenia, and thrombocytopenia. They are classified as 2 groups: primary hypersplenism, underlying a disease cannot be identified due to exaggerated splenic function. Majority females are affected. Clinical features: fever, frequent and recurrent infections, oral ulceration with neutropenia, fatigue and ecchymosis, and pallor. Treatment: corticosteroids, later splenectomy carried out. Secondary hypersplenism, hypertrophy from immune response, infectious mononucleosis, Plattis syndrome. Hypertrophy from red cells destruction, thalassemia, spirocytosis, venous congestion, example portal hypertension, splenic thrombosis, myeloproliferation, example myeloid metaplasia, chronic myelocytic leukemia, infiltration, example Gotcher disease, sarcoidosis, neoplastic proliferation, example lymphomas. Okay. Rupture of spleen causes: blunt injury to the abdomen, injury to the left side of chest, left lower rib fracture, RTA, retroperitoneal hemorrhage, fracture of spine, and renal injury. Penetrating injury to the abdomen, spontaneous rupture, disease like malaria, infectious mononucleosis, rarely in sarcoidosis, hemolytic anemia, leukemia. Heterogenic cause during surgical procedures such as vagectomy and gastrectomy. Clinical features: due to tearing of splenic vessels, evolution of splenic pedicle give rise to hemorrhagic and shock that can occur immediately in few minutes. Patient can develop hemorrhagic shock due to the capsular tear or injury to the splenic parenchyma. We can notice the following clinical features: pallor, tachycardia, hypotension, cold and clammy extremities, abdomen distension, guarding and rigidity. Disease of spleen. Etiology as follows: infection, bacterial infection, TB and endocarditis; viral infection, mononucleosis, HIV; parasite infection, malaria and toxoplasmosis; inflammatory disease such as sarcoidosis, lupus, and rheumatoid arthritis. Cyst in spleen, large abscess caused by bacterial infection; blood cancer like leukemia, myeloproliferative neoplasm, lipomas like Orkin's disease, metabolic disorders, Gotts's disease, and Neem and Spick disease. Symptoms: complaints of pain or fullness in the left upper belly that can radiate to the left shoulder or a back. Feeling of fullness without eating after eating a small amount of food because due to the pressing of spleen on the stomach. Frequent cold and infection, easy bleeding and bruising, weakness due to the anemia and fatigue. Physical examination. On inspection, we should observe the patient abdomen. During inspiration, in enlarge of spleen, we can see the edge descending in the left abdomen or in the right abdomen in extreme cases. Pain on the top of its shoulder is associated with inspiration. On palpation, patient should be in the supine position with knee flexed, using right hand being well below the left costal margin and feel gently and firmly for splenic edges. Keep the right hand and ask the patient to take a deep breath throughout the mouth to feel the spleen edge being displaced downwards. Move the hand diagonally from right iliac fossa towards the left upper quadrant on expiration. Place left hand around the patient's lower rib. Approach from costal margin to pull the spleen forward. On percussion, examine the spleen with the patient holding a breath during full inspiration. Percuss the both below and then above the left costal margin. Percussion can run from resonance to dullness. On auscultation, bruise the sound and turbulent arterial flow. Investigations: CBC, LFT, blood culture, HP electrophoresis, Coombs test, red cell enzyme test, coagulation test, serum amylase and lipase, USG, CT scan, splenophotography, MRI, spleen colloidal scan, angiography, X-ray of chest and bone. Diagnosis: history-wise, blood test, USG, CT scan, MRI, check out underlying disorders. Treatment: depends upon the disorders and specific cause. Immunization and splenectomy. Spleen disorder patient exposed to the increased risk of infection, most commonly pneumococcal infection. So some vaccines are advised. Example: pneumococcal vaccine, meningococcal vaccine, hemophilia influenza type B vaccine. Indication of splenectomy: blood disorders, acute and chronic leukemia, sickle cell anemia, thalassemia. Infective: bacteria like typhoid, paratyphoid, TB, septicemia, anthrax. Viral: infections of mononucleosis, psittacosis, protozoal and parasitic, malaria, Kala Azar, iodide cyst, tropical splenomegaly. Neoplastic: tumors of spleen, reticulum cell sarcoma, Hodgkin's and non-Hodgkin's lymphoma. Circulatory disorders: portal hypertension, splenic vein thrombosis, infarcts, cyst of spleen, miscellaneous disease, sarcoidosis, Gotts's disease, Fletcher's syndrome. Complication of splenectomy: injury to the bowel, diaphragmatic injury, pancreatic injury, vascular injury, pulmonary, splenosis, paralytic, pilatus, hematemesis. Conclusion: if the patient experiences any organ-related issue, immediately he should contact the concerned doctor. It is the best investigate immediately. Example: infection, other cause, and treat as soon as possible. The organ spleen can be removed in severe cases and malfunction after removing the organ. The patient will susceptible for disease. Patient should maintain the vital functions by taking the vaccines and other preventive measures such as washing his hands and avoid the persons who may be contagious. Thank you.
Thank you for this informative session, Dr. Jayanth.
Thank you, ma'am.
So next I invite Dr. Deepal Tambat for the paper presentation. I invite Dr. Deepal.
Hello,
Hello.
am I audible?
Yes, doctor, you're audible.
Good evening, everyone, the honorable panel and participants. Hello.
Yes, yes, doctor, it's visible.
Is my screen visible, ma'am?
Yes, doctor,
please
it's
continue, doctor.
visible.
Okay. Good evening, honorable panel and all my fellow participants. Today, the topic for my paper presentation is Management of Acne with Triphala Mashi and Neem Patra Churna Lepa. It is carried out under the guidance of Dr. Shaileja Chondikar, HOD and Professor, and my guide, Dr. Ketki Adav, who is an Associate Professor of Department of Rasashastra and Vaishajya Kalpana at Sri Saptashrungi Ayurved College and Hospital, Nasik. The title is Management of Acne with Triphala Mashi and Neem Patra Churna Lepa. For the introduction part, I'll say that the acne, as we all know, is an inflammatory condition of the sebaceous glands. Sebaceous glands are the oil glands present on our skin. The acne affects most in the adolescents, which is the age group of 10 to 19. And acne is known as the Mukha Dushika and is explained in the Shudra Rogas by our acharyas. In acne, there is basically the formation of the pustules, papules, nodules, cysts, which may lead to the pigmentary changes of skin and scarring over the acne region. For in regards of the case, we can consider this as a common problem in both the genders, rather it be male or female. In modern science, the treatment prescribed is topical chemical-based application, whereas in Ayurveda, we have good herbs which prove to be good relaxing veneer to the skin. Here, I have made an attempt to combine Mashi prepared with Triphala and Neem Patra Churna, and I have given for Lepa application. The Mashi Kalpana's references were first laid down in the Sushruta Samhita, and in Mashi Kalpana, it is basically about a particular dravya burned by the Antardhuma or the Bahirdhuma Paddhati, and the burned material, which turns black in color, is collected and Mardana Sanskar is performed in Kharal. In acne, there is breakout of, according to Ayurveda, there is breakout of Kapha and the Vata dosha, and there is Dushti of the Raktavaha Stropas. Here, Mashi Kalpana is chosen because it has greater penetrating action, even a small amount of drug acts as an adsorbent on skin. Neem Patra Churna, it is widely known for its antibacterial and antioxidant properties, and hence it is used for treating acne. The aim of my study is to study the effectiveness of the Triphala Mashi and Neem Patra Churna externally in Lepa form for reducing the acne pustules or the scars. Objective of my study is to examine the effectiveness of Triphala Mashi and Neem Patra Churna given for the external application in patients with acne, that is the Mukha Dushika, and also to investigate the various external factors leading to the cause of acne. Materials I used for my study were Triphala Mashi, Neem Patra Churna, rose water, which was used as an vehicle to mix Triphala Mashi and Neem Patra Churna for Lepa preparation. And I have used a chart of acne for comparison. The chart of acne is shown in grades, that is grade 1, grade 2, grade 3, and grade 4. According to severity, grade 1 is mild severe, and it clinical finding shows open and closed blackheads with few inflammatory papules and the pustules. Grade 2, it shows moderate severity. There are papules and pustules mainly over the face region. Grade 3, the severity is moderately severe, and the clinical findings are numerous papules and pustules and occasional inflamed nodules also over the chest and the back region. Grade 4, it is severe, and there are large painful nodules and pustules over chest, back, face, everywhere. The method used was I had done a pilot study over 10 volunteers using Triphala Mashi and Neem Patra Churna. I gave them for external application. The formulation given for application was Triphala Mashi plus Neem Patra Churna, which was mixed with rose water, and it was given twice a week for application. On an average, it was about 8 to 10 applications per month, and a patient was advised to wipe the Lepa as soon as the Lepa got dried. And acne comparison of before treatment and after treatment using acne comparison chart was done, and the results were noted. The results showed a positive response after the 5th to 6th application of the Lepa, and the patient felt a clear face than before, and the size of pustules also reduced. Here are few images of before and after treatment. Coming to the discussion and the conclusion part, we can say that acne is mostly a result of clogging of oil into our sebaceous glands, and patients observed were amongst the age group of 15 to 30 mostly. Lepas, as said, they act as an astringent, anti-inflammatory and antibacterial agents, and Lepas not only treat the acne but also increase the skin complexion. If we see according to modern pharmacological aspect, we can say that charcoal is made by burning of wood or coconut shell in an atmosphere containing the minimum oxygen. So they acquire good adsorbent properties. Adsorbents are used in medicines to remove gases, toxins, and poisons. Adsorption is a physical phenomenon. It is exhibited by the particles where the substance are bound or made to adhere to the adsorbent. Hence, I paired it with the Mashi Kalpana and prepared Triphala Mashi and gave it along with the Neem Patra Churna. Hence, when I combined the results, I observed significant results in the acne of patients, and we can conclude that the Lepa formulation prescribed is working on acne. The references I took were from the Charak Samhita of Agnivesha, elaborated by Charaka and Durvadi, from the Chaukhamba Surabharati Prakashan, Varanasi, Chikitsa Stan 10/40, page 476. Kaviraj Shri Vibhuti Bhushan, Sharangdhar Samhita, Pandit Pustakalaya, Kashi, Uttarakhanda, chapter 11/2, page number 381. Dr. G. Prabhakar Rao, a textbook of Bhaishajya Kalpana Vijnanam, Chaukhamba Prakashan, and chapter 5, page 216. Same I took for page 217, 218 from the same book. The next reference I took was from the Professor P.V. Sharma, reprint of 2013, Dravyagun Vignan, volume 2, Varanasi, Chaukhamba Bharati, chapter number 9, 31st, page number 758, 760. Same I took from chapter number 4, 93. Same I took from chapter number 9, 340, page number 753 to 758. Next reference was from the article of Dr. Praveen A. Patil, Dr. Meenakshi U. Harishchandre, Dr. Sharda N. Chirkute, Mashi Kalpana, a review, Journal of Ayurveda Integrated Medical Sciences, March and April 2019, 68 to 69 pages. Professor P.V. Sharma, reprint 2013, Dravyagun Vignan, volume 2, Varanasi, Chaukhamba Prakashan, and chapter number 2, 57, page number 149 and 151. Next article reference was taken from the Jetal Gevaria, Sangeeta Kamalia, Waghela DB, a case report, management of Mukha Dushika, that is the acne vulgaris with Ayurveda, IJAM, volume 12, 148 to 152. And the last reference was taken from the Kraft J. Freeman, management of acne, CMAJ 2011, April 19th, 183.7, E430 to 5. Thank you.
Thank you, Dr. Deepal. So let me invite Dr. Poonam Dilip Patil. I invite Dr. Poonam Dilip Patil. Dr. Poonam.
Hello, Dr. Poonam Patil. We can't hear your voice, doctor. Please reconnect your headset, doctor.
Dr.
Hello,
Poonam.
Dr. Poonam Patil. Doctor, please reconnect your headset, doctor.
Dr. Poonam, you are not audible. Try to reconnect.
Okay, we will call you next, Dr. Aishwarya.
Okay, doctor. So next I invite Dr. Sagar. I invite Dr. Sagar Dattatray for the paper presentation.
Good evening.
Good evening, doctor. You are audible. Please Share your screen.
Just a minute.
Hello, Dr. Sagar. Hello, Dr. Sagar, the ranking.
Is the screen visible?
No, doctor, not visible, doctor.
Wait a minute.
Okay, you have any problem with screen sharing, doctor?
Yes, sir.
Okay, I will share for you, doctor. 1 second. Doctor, please chat, doctor.
Sorry.
Is the screen is visible, doctor? Hello, Dr. Sagar. The screen is visible, doctor.
No, sir. Still not. Yes, sir.
Doctor, my screen is visible,
Yes,
doctor.
sir. Yes, sir. Yes, sir.
Okay.
Good evening, all. Shall I start?
Yes, doctor.
Yes,
Please chat,
doctor, please.
Today, I am going to present the topic a review of ancient and contemporary maternal position during second stage of labor. Next slide, please. As we all know, labor is said to be the second birth of every woman. Normally, labor consists of 3 stages: first stage, second stage, and third stage. Among all these, the second stage is the most crucial one. It is the most stressful to the mother, fetus, and also to the obstetrician and the personnel who is going to conduct the delivery, that is obstetrician and midwives. Various maternal positions are in practice to increase maternal and neonatal outcome, each having their own risk and benefits, such as a supine position, vertical position, standing position, and so on. Next slide, please. Why we are going to study the review of various maternal position? Because different maternal position have different aspect on the neonatal as well as maternal outcome, such as prolonged duration of second stage of labor leads to perineal tear, postpartum hemorrhage, operative delivery, intrauterine infection leading to puerperal sepsis, and also decreasing neonatal outcome by birth asphyxia, stress, intracranial hemorrhage, and infection. That means various maternal position can lead to maternal and fetal morbidity as well as mortality. Some maternal position, if given during unfavorable condition, may commence in perineal trauma, obstructed labor, or postpartum urinary or anal incontinence. In future, such large perineal tear may develop into vesicovaginal fistula, rectovaginal fistulae, complete perineal tear, and so on. That's why the delivery which will taken in the home or conducted by the untrained persons may lead into the perineal tear and may develop into in future fistula and so on. So here is an attempt to review on different maternal positions described in ancient as well as contemporary sciences and discuss and compare with their own benefits and risks. Next slide, please. What are the aims and objective? By this study to review of different maternal positions during second stage of labor described by ancient and modern sciences, and to compare between them for greater obstetric outcome. The materials and methods used were Vedic literature from Vedic period. Next slide, please. Literature from Vedic period, Ayurveda, and contemporary sciences were explored, so, as well as the research articles relevant to the subject were reviewed. Next slide, please. Sorry. Next. Sir, next slide. Furthermore, if you look into the ancient science, the first picture we have seen the Lajja Gauri. The Lajja Gauri, the lotus-headed Hindu goddess associated with the abundance, fertility, and sexuality. She is known in birthing posture, but without outward signs of pregnancy. She is the sitting in squatting position with legs open, as in during childbirth. Next, please. In Ayurveda, Acharya Charaka and Acharya Vagbhata advocate supine position for expulsion of fetus during second stage of labor. Each as the squatting position has its different benefits, while supine position has its different benefits. In earlier period, the commonest position has been upright or vertical position. That means standing position. Francois Mancue, a French obstetrician, introduced semi-recumbent position for easy process in applying forceps. For the instrumental delivery, the supine position may get difficult for the obstetrician to apply the forceps or the vacuum for any instrumental delivery. So these semi-recumbent position were evolved. By the time advances, the semi-recumbent position evolved into the recumbent position or lithotomy position. In 1996, WHO recommended upright position and stated women should choose the maternal position according to their preferences. Next slide, please. The research article shows maternal position can be classified into upright position and neutral position. In upright position, there are four positions like sitting, squatting, kneeling, and standing. While in neutral position, lithotomy, supine, and lateral. Next slide, please. Each have their own risk and benefits. Sitting position, the semi-sitting position, women's in sitting position, there is semi-sitting position or sitting upright. In semi-sitting position, woman sits with her trunk at an angle greater than 45 degree to the bed. While in sitting upright, more common in Western countries we use, woman sits straight up on a bed, chair, or a tool. Nowadays, labor tool such as labor ball, labor stool can be used. Next slide, please. In kneeling position, it vary from upright kneeling to all fours position. All fours is a different type of position, type of kneeling position. In these, woman kneels down, lean forward, and supports herself on either the palms of her hand or her fist. In cases like shoulder dystocia, the kneeling position may help to deliver the baby easily. The squatting position. Woman's weight rests mainly on her feet, but her knees are markedly bent, and again, she may pull on some support. Difficult for pregnant women to maintain the squatting for a long time. The advent of supporting tools may solve this problem. In cases of deep transverse arrest or non-descending of the presenting part, the squatting position helps a lot. The lithotomy position, common used in Asian countries. Next slide, please. Common used in Asian countries. The advantages are though to monitor progress of labor. It is the most commonly used position in India or in Asian countries to monitor the progress of labor for the obstetrician and midwives, to implement hands-on maneuver when needed. The supine position. Next slide, please. Common in Asian countries, the woman lies flat on her back with her trunk slightly raised with 45-degree angles to the horizontal, her legs outstraight, bent with her feet flat on the bed. In the legs rest or drawn back toward her shoulders. Advantages are 15% left lateral tilt, avoids aortocaval compression and facilitate pushing efforts. The 15-degree left lateral tilt may help to reduce the fetal distress caused by the aortocaval compression and facilitate the uteroplacental sufficiency or the uteroplacental blood flow to for greater neonatal outcome. Next slide, please. The lateral position. Pure side lying. Woman lies on her side with both hips and knees flexed and a pillow between her legs or with upper legs raised and supported. Exaggerated seams position. It is common in France. Woman lies on her side with lower arm behind her trunk, her lower leg extended, and her upper hip and knee flexed 90% or more. She rolls partly towards her front. The first pure side lying is much similar to the position of Basti for the any kind of human. Advantages of lateral position are easy, reproducible, comfortable, and most importantly, it is also used in epidural analgesia. In epidural analgesia, when we use the painless delivery, mostly the supine position is preferred. But if the woman is preferring the other position, the exaggeratory seams position or pure side lying position can be chosen. The characteristic and of the various maternal position. Some maternal position accelerate the progress of labor, while some elevate the maternal pain, while some may contribute to the poor neonatal outcome, such as squatting and sitting position accelerated progress of labor due to descending of presenting part, while squatting and sitting position are much needed to elevate the maternal pain. While the in supine and lithotomy position, more maternal pain is exerted. Upright, lateral, and kneeling position causes less perineal trauma, but it is difficult for the obstetrician or the midwives to observe or to monitor the patient. Lithotomy, squatting, and lithotomy supine positions are more induces for the more perineal trauma, while in multipara, the perineum already is much thin out. So the perineal chances of perineal trauma are more higher in the squatting position. Upright position causes more blood loss, while upright and lateral position causes better neonatal outcome, while supine and lithotomy position gives more neonatal compromises. The shoulder dystocia, the obstetric labor or causing the shoulder dystocia. If we use the all fours position, the shoulder dystocia baby may get delivered fastly or easily without having any fetal or neonatal compromise. While in OP, occipito-posterior, the lateral position may serve as non-medical intervention. In epidural anesthesia, mostly supine or modified seams or pure side-lying position may be preferred. For instrumental delivery like vacuum ventouse application or forceps application, the lithotomy position is preferred. While we discussing the various maternal position, as upright position has lesser morbidity outcome, but close monitoring is must in upright position to avoid birth injuries. As this position tends to more blood loss, the necessary management tools must be prepared for postpartum hemorrhage. Next slide, please. The supine position described in Ayurveda literature have less complication but taking longer duration for progress of labor. While the Acharya Charaka and Sushruta have described the supine position for the easy management of labor, but this position, if we use for the longer period, the duration of labor, that is for first stage and second stage, may get prolonged. The squatting and kneeling position helps in shortening the duration of second stage of labor. After the review of all these positions, we can conclude that, next slide please, as no evidence exists to support the ideal maternal position during second stage of labor. That means each position has respect to their own risk and benefits. Thus, each position has respect to risk and benefits. So the maternal position should be adopted as per the case needed. That means if the case is of obstructed labor, the shoulder dystocia, the all fours position can be adopted. But if the case is of instrumental delivery, the lithotomy position can be chosen. But if the cases is of epidural analgesia, painless delivery, the supine position must be adopted. I have taken the next slide, please. I have taken the references from internet source, Acharya Charaka Samhita, Acharya Sushruta Samhita, Acharya Bhagavad Samhita, and some medical journals available in the internet source. Thank you for
Thank you, doctor. So next I invite Dr. Poonam Dilip Patil.
Am I audible?
Hello.
Hello.
Doctor, your voice is breaking.
Yes, am I audible?
Yes, you are audible, but your voice is breaking, doctor.
Okay, can you share the screen?
Yes, 1 second, please. Dr. Sabin. Hello, Dr. Sabin.
Yes, doctor.
Can you please share the screen?
Okay, one sec, doctor. Hello, Dr. Poonam Patil, can you hear me?
Yes, sir.
Okay, doctor.
Yes, sir. Am I audible?
Yes, doctor, audible, doctor. Please start the session, doctor.
Good evening, respected dignitaries and all my fellow friends. Myself, Dr. Poonam Patil, PG scholar, Department of
Hello,
Research
Dr.
and
Poonam Patil.
Hello.
Hello, Dr. Poonam Patil. Your
Yes,
voice is
sir.
breaking, doctor. Your voice is breaking, doctor.
Still breaking, sir.
Yes, doctor, breaking, doctor. Once again, reconnect your headset, doctor. It's a problem of
Yes.
your headset or connector, doctor.
Sir, I am trying to be full network.
Poor network. Okay. Okay, doctor. Continue, doctor.
Can I continue?
Yes, doctor. Please continue, doctor.
Myself, Dr. Poonam Patil, PG scholar, Department of Rasashastra, Vaisheshya Kalpana. My guide is Dr. Apeksha Patil and HOD is Dr. Shailaja Chopikar from Saptashungi Ayurapta. Next slide, please. Title is Role of Durvadi in the Management of Dadru, that is Tinea corporis. Introduction. Economic development that led to lifestyle modification, environmental pollution, composition, consumption of unhealthy food or unhygienic conditions, skin diseases were common. Twacha, that is skin, is the largest organ in the body and has great cost. According to Ayurveda, all skin diseases are categorized under Kushta. Next. Dadru is described as Shudra Kushta by Charkacharya and as Mahakushta by Shushrutacharya and Vakacharya. In Ayurveda, concept of tinea infection can be correlated with Dadru. It includes fungal infections, tinea on groin, buttocks, axilla, neck, face, etc. regions. Dadru diagnosed by symptoms such as itching, erythema, eruption, and elevated cellular patches, same as tinea corporis symptoms. Positive factors are ahar, vihar, creamy, that is fungi and bacteria. Here, creamy are fungus or dermophyte, responsible for tinea, ringworm, or tick. They are highly contagious infections. According to Ayurveda, medicine in the form of paste used for external application is called as lepas. Our Samhitas will describe different types of lepas for every skin infection. For antifungal infection, Dadru, that is Durvadi lep, is specially described as Chakrata in Pushta Chikitsa Adhyay for external application. Next slide. In Durvadi lep, Durva is Kashai Madhu plus Sheet in Virya and its Dipak is Madhu, which helps to balance cough as well as Pitta Dura. Also, it is Prana, Daha Prashaman and Vard. Because of all hetus, itching, erythema, eruption, and elevated circular patches, which lead to Dhatukshay and Dosha imbalance. Durvadi contains Durva, Haritaki, Chakramarda, Utterak, that is Vana Tulsi, etc., which gives burden. Next slide. Here, Kurushi, Atisnigdha, Ahar, plus Vihar, plus fungal bacterial infection leads to Kapha and Vata, and also Dhatukshay, which leads to Kandudan, itching, Rag, that is erythema, Pidak, that is eruption patches. Next slide. My aim here is to study the effectiveness of Durvadi in treatment of Dadru, that is Tinea corporis. My objective is to study effectiveness of Durvadi locally for reducing the above symptoms, to investigate various causes related to Dadru and Tinea corporis. Next slide. Material used here are Durvadi leaf, which contains Durva Churna, Haritaki Churna, Sendhav Dagat, Chakramari Churna, Utterak Churna, and also structure used to mix it is Kanji and Patra. Next slide. Method used here is study has been conducted on patients by applying Durvadi leaf for external application on affected site. Durvadi leaf is mixed with Kanji and Takra and applied on affected site for 1 minute. On basis of visual observations like decrease in redness, eruption, itch. Next slide. Here the patient's forehead is given. My result is a positive result was observed after applying Durvadi leaf on affected site. Also decrease in itching, redness, and eruption patches is observed. Discussion and conclusion. It is concluded that external application Durvadi has reduced the itching, redness, and eruption patches after 4 to 5 applications. Next slide. References I have taken. Main reference is from the Indradev Tripathi Chakradatta Chokhamba Sanskrit Sansthan Varanasi, and their references are other are taken from Charak Sanhita, Sushrut Sanhita, Bhagavad Sanhita, Dravya for the Dravya used, and other are taken from the sites.
Thank you, doctor.
Thank you, doctor.
Thank you.
So next I invite Dr. Vaishnavi Vaje. I invite
Yes, ma'am.
Dr. Vaishnavi.
Yes, ma'am.
Good evening, doctor. You are audible. Please share the screen.
Yes, ma'am. Ma'am, I have trouble to sharing the PPT of paper presentation. Can you share the PPT?
Please wait, doctor.
Okay,
Dr. Sabir.
one second, doctor. I'll share for you, doctor.
Yes, sir.
Dr. Vaishnavi,
Yes,
please
sir.
start.
Yes,
Please
sir.
start.
Thank you, sir. Good afternoon, all. The topic of my paper presentation is conceptual study on the Bal Graha. My name is Dr. Vaishnavi Babbanwaje, PG scholar, guided by Dr. Mayuri Nagre from SMBT Ayurved College and Hospital, Nasik. Next slide, please. Abstract. A unique concept regarding disease caused by the unidentified vectors known as Bal Graha, which is described in the Kaumar Rutya. Unfortunately, it is abandoned in today's era due to its mythological explanation, which kept evidences far away from scientific justification. Therefore, an effort has been done in this paper with an aim to understand the Bal Graha on modern parameters as well as clinical application in day-to-day practice. After through study of the concept of Bal Graha, it is concluded that these identified vectors are thought to be the microbes which cannot be seen by the naked eyes but produce the group of diseases of multisystemic origin and syndromes. Next slide. Introduction. The Graha Rogas have separate entirety from the other general disorders. The etiopathogenesis, clinical features, severity, complications, and management is entirely different to the root disorders of children. They affect a large number of pediatric age group. Their progress in human body is very rapid with high morbidity rate. Disease caused by unidentified factors are termed as idiopathic in modern science, but Bal Graha, Jat Harnis, Adi Bal Pravrut, Janma Bal Pravrut, etc. These disorders in our classics are attributed to goddess since of previous birth and a result of bad deeds in our daily life. It is the combination of two words, that is Bal means child and Graha means seeds or grass. Next slide. Aim and objective. These are the to study the concept of Bal Graha through the Samhita Granthas and to study the concept of Bal Graha through the modern point of view. Material and methods. The material which is collected this from the classical Ayurvedic Samhitas, text, modern literature, journals, previous research works. Next, characteristics of Bal Graha. In Revati Kalpanadhyay, Acharya Kashyap has described the morphology, habitat, and characters of grahas. First, grahas are visible only to divine vision, that is the Divya Chakshu. Second, they are fond of Rapta mounds and ojas. Third, these dwell at water tanks, that is Shita Putana, ruined houses, that is Putana, cow sheds, Mukha Mandika, and bases of the trees, that is Pitrugraha. Jatharni, which attacks the pregnant women and the fetuses in highly contagious. Next, this white the breast milks of Dhatri 2. The description of microscopic morphology, innumerable in number, survival in unhygienic in atmosphere and blood medium as positive culture. From this, it exactly indicates that grahas are no other than the microorganisms like virus and bacteria. Next slide. Types of the Bal grahas. The Acharya Charak stated that the grahas are innumerable in number. Acharya Sushruta stated that gives more importance to the Bal graha, and these are the 9 in numbers, that is Skanda, Pasmar, Shakuni, Revati, Putana, Andhaputana, Shita Putana, Mukha Mandika, and Naigamesh. Acharya Vagbhat stated has added more 3 grahas, that is Shva graha, Pitru graha, and Shushka Revati graha. Acharya Kashyap stated in first in Sutra Sthan, due to the vitation of breast milk, Shakuni, Skanda, and Putana. In Indriya Sthan, Skanda, Pasmar, Pitrigraha, Pundarika, Revati, Shushka Revati, Shakuni, Mukha Mandika, Putana, and Naigamesh. In Chikitsa Sthan, about treatment of child affected by Revati, Putana, Andha Putana, Shita Putana, and Mukha Mandika. Next slide. Etiopathogenesis of Bal graha. Children are mostly affected by grahas because they are dependent on others. Therefore, they are unable to maintain proper hygiene by themselves. Secondly, they are deficient in immunity, thus more prone for the infection. Acharya Sushruta illustrate the number of different causative factors into 2 major categories. First, related to unhygienic condition, regulation of lifestyle of child and mother, such as feeding is unclean and broken vessels with unhealthy condition of surrounding environment. Second, the psychological aspect of child, such as showing misconduct in front of teachers, guests, and their movement to lonely. This refers to bipolar mood disorders with immunological breakdown. Next slides. Symptoms of Bal graha with modern correlation. There are 2 types of symptoms. The prodromal symptoms are weeping and fever. Second, general symptoms, it is depend on the infliction of that particular graha. First, in Skanda graha, it correlate with the polio, facial palsy, and hemiplegia. Skanda Pasmar is correlate with the convulsion and epilepsy. Mesh graha correlate with the meningitis. Shva graha correlates with the hydrophobia and rabies. Pitri graha is correlate with the diarrhea with dehydration. Shakuni graha is correlate with impetigo and stomatitis. Putana graha correlates with diarrhea with hypokalemia and paralytic ileus. Shita Putana graha is correlate with the diarrhea with hypocalcemia and with hypomagnesia. Andha Putana is correlates with the diarrhea with vitamin A deficiency with secondary infection. Revati graha correlates with the diarrhea with anemia. Mukha Mandika graha correlates with the childhood cirrhosis and nephrotic syndrome. Shushka Revati graha correlates with the marasmus and abdominal TB. Next slide. Management of Bal grahas. Next slide, please. Management. There are 2 types of management, external use and internal use. For the external use, we apply Parishek. It should be done with the decoction of Agni Mantha, Varun, Haridra, and Chitrak. Second, Abhyanga. It should be done with the oil prepared from Priyangu, Lochan, Tagar, Jatamasi, Sariva, Ela, Madhuka, and Bhunimba. Third, Bali and Snanam. It can be administered by Til, Tandul, Mudga, Mounds, and Matsya. Next, Dhupan. It has been devocated by the Gajanak and Ushtra Roma. For internal application, we use Kwat prepared by the Bimba, Gambhari, Madhuk, Kulatha, Yav, and Lagu Panchamun. Second, Churna, which is prepared from the Kharjur, Mustak, Narikel, Mridvika, and Madhuka. Third, Rasa Ushadis, which is prepared from the Kumar Kalyan Ras. Kumar Kalyan Ras oil, Mahamash oil, Shir Bala oil, Prasarini oil, and Jyotishmati oil. Grut, which is used is Bal Harit ki Grut, Ashtamangal Grut, and Bal Grahasap Grut. Next slide, discussion. It is one of the important part of Ayurvedic text. Their impact and overall the state of children need proper explanation. In ancient period, there was no advanced technology for the diagnosis, equipments for and treatment, but they describe details and accurate description about the diseases and their origin. Now, modern terminologies are most specified and specific causative organisms of disease. Modern lab techniques are more useful to visualize microbes. Next slide, conclusion. On the basis of the above description, it is clear that Balgrahas are now compared with the various microbes infections, which can be treated with a combined approach of therapeutic and psychiatric management. Also, arise the importance of cleanliness and hygiene measures to adopt in routine life. Next, references. The main references are taken from Kashyap Samhita, Sushrut Samhita, Charak Samhita, and Vagbhat Samhita, and some modern literatures. Thank you.
Thank you, Dr. Vaishnavi, for this
Thank you.
understanding presentation.
Thank you, ma'am.
So next I invite Dr. Mrunali Pudarkar. I invite Dr. Mrunali.
Yes, ma'am.
Good evening, Doctor.
Uh,
Doctor,
Good
please
evening, ma'am.
share your screen.
Yes, ma'am. Ma'am, I'm not being able to share. Can you please share my PPT?
Sure, Doctor. Dr. Sabin.
1 second, doctor. I will share for you, doctor. Dr. Mrunali, please start, doctor. Is the screen is visible, doctor?
Yes, sir. Yes. Myself, Dr. Mrunali Purarkar, PG student of Kaumarkritya department from SMBT Ayurved College, Dhamanggaon, Nashik. My today's topic is ADHD and Ayurved. Next slide, please. Abstract. ADHD is a attention deficit hyperactive disorder, which is a behavioral disorder. The symptoms usually begins to appear in a children at around 2 years of age, and it may continue up to adulthood. It interferes with the social, academic, and occupational functioning, and it is characterized by inattention, hyperactivity, and impulsivity. The incidence of the ADHD in school-going children in the West and India ranges from the 5% to 10%, 2 to 4 times more in boys than that of girls are affected. Ayurveda explains this disorder of the Vatika Unmada, which is closely related to the symptoms of ADHD. Early diagnosis and a prompt treatment will help to resolve the manifestations of ADHD. So here the Ayurveda has an effective and exclusive treatment protocol to reduce the intensity of the ADHD symptoms. Next slide, please. Need of this topic is the occurrence of the disorder is increased in the last few years. It is directly affecting the children in their developing age. It affects students' ability to focus, pay attention, listen, to put efforts into the schoolwork. In addition to psychotherapy, speech therapy, behavioral therapy, the use of the Ayurvedic treatment and the methods will reduce the intensity of the ADHD symptoms. Next slide. Introduction. ADHD is a neurobehavioral disorder which constitute various symptoms like lack of concentration, impulsivity, lack of self-esteem. It is characterized by the inattention with increased distractibility and difficulty in sustaining attention, poor impulse control, and decreased self-inhibitory capacity, as well as the motor overactivity and motor restlessness. It manifests during the period of the education, and it is an important cause of the poor academic performance in school. It includes mood changes, aggressive behavior, temper tantrums, easy distractibility, restlessness, which leads to the educational underachievement. It is not a problem with the intelligence, and it is diagnosed, if it is diagnosed and treated on the line of Vataja Unmada in Ayurveda. It could be treated like a Vataja Unmada. Ayurveda therapies can use to improve the brain functions, concentrations, and the mind calmness. Next slide. Causes of ADHD. The exact reason of the occurrence of the ADHD is not still not clear. The central nervous system is involving, that is, the brain is supposed to be affected. Genetic factors, environmental aspects, ill effects of food or medicine during the pregnancy period, etc., are the considered as a sum of the probable reasons. The genetic factors, mainly in the presence of Shukra and Artava Dushti or the Garbhaja Karanas, can be considered into the genetic factor. The environmental will be unfavorable, improperly prepared food and water, improper timing of food intake, over fatigue, and the mental can be included. The children are basically alpasattva, which can we can say weak mental strength, and mental depression, anger, and grief. Next slide. Diagnosis criteria can be taken as a DSM-4 ADHD diagnosis scale. And second, we can take as a clinical assessment of the case, includes taking a standard medical, family, developmental, and their dietic, nutritional history, along with the general and the suitable systemic examination. Next slide. Ayurvedic references of Vatika Unmada, which is given in Ashtanga Hruday Uttar Sthana. The above shloka defines that the pathogenesis of the Unmada Roga, it is referred as a mental disorder framed under the vitiated physical and the mental doshas. The doshas dislodge from the basic sites and circulates irregularly through body, manifesting various behavior abnormalities. Ayurveda explains symptoms similar to ADHD as an emaciated body, inappropriate emotional expressions like crying, anger, or laughing, over talking, hyperactive, and constantly changing concentration. Next slide. ADHD and Ayurvedic pathology aspect, we can say the dosha which is affected is a vata, that is a chalaguna vrud. If there is a chalaguna vruddhi, then it will lead to the hyperactivity, and if there is a chalaguna kshaya, then it will lead to late or no response, which we can also say not attentive. The dusha which is involving is a majja dhatu, majja vah srotasa, and manovah srotasa. Adhishtan, we can say brain and mind, and manasika dosha, we can say rajayana tamaguna vruddhi. Next slide, please. Types of ADHD. There are three types of ADHD, which we can say first one is a inattentive type, second one is a hyperactive or impulsive type, and third one is a combined type. Next slide. Next slide. Symptoms of ADHD. So here inattentiveness. Yes, sir. Next slide, please. Inattentiveness, we can see the easily distracted child, unorganized child, and the child with the difficulty in listening. In hyperactive or impulsive child, we can see the difficulty in sitting still, and rush through the task, and make rash decisions. And in a combined type, we can see the symptoms of the both the types. Next slide, please. management. Here we can include the ahara, vihara, and aushadhi, chikitsa. Avoid vata prakopaka ahara and vihara, as we have seen that the vata is the main causative agent for this. To control raja and tama, we can use the sattvavajay chikitsa, that is a psychological counseling, assurance, supportive and loving atmosphere, and music therapy. Increased sattva guna can be done with the sattvic food like grita and honey. In Vihara, we can include the Ayurvedic daily regimen like meditation, pranayama, adequate night sleep, regular exercise, Surya Namaskaram, brain occupied in positive things, cultivation of the good habits like reading and listening, motivational speeches, painting and crafts, and most importantly, to avoid screen time of computer, mobile or TV. Next slide, please. Best treatment plan we can give Snehana, Swedan and Basti. Here Pratimarsha Nasya can play an important role, as we know that the nose is the entrance of head, and so that the Nasya can directly affect the brain. Here we can give Anu Taila or Yashti Madhugrita or Kshirabala Taila Nasya or Nasya of Brahmi Ghrita. Murda tail can be helpful for this, which includes Shiro Abhyanga, Shiro Pichu, Shiro Dhara, Shiro Basti, for the calmness and the mind, calmness of the mind, and which reduces the Chalaguna of the Vata. Here Rasayana Chikitsa, which includes here the Acharya Charaka defines the Rasayana as a source of the achieving the excellent quality of the Rasadi Dhatus, which increases the lifespan, improves medha, stabilizes the youthfulness, cures diseases, improves complexion, luster, voice, and makes body strong and healthy. Medya dravyas like Shankha Pushpi, Guduchi, Yashti Madhu, Mandupani, and Grita can be useful in this. Panchakarma procedures, it can be included the Snehana, Abhyanga, Shirotalama, Pratimarsha Nasya, Matravasti can be useful for this. Next slide, please. Here, the conclusion. Ayurvedic treatment with therapies aimed at improving brain functions, herbs and remedies to enhance attention and mind calmness, along with cognitive behavioral therapy, can be very helpful in the ADHD. ADHD is a predominant Vata dosha behavioral condition that affects Manovaha Srotasa, and as a result, a therapy that corrects the imbalance of dosha improves and normalizes the brain problems with memory, intelligence, focus, learning capacity, speech production. Medhya, that is a non-tropical herbs that enhances the mental function and balances. That is, these Medhya dravyas and the herbs that pacify the Vata are the main line of the treatment. In addition to psychotherapy, speech therapy, behavioral therapy, the use of Ayurvedic treatment methods will accelerate the progress in ADHD. Next slide, please. I have taken these references from the various online, that is online sources, from the also from the Vagbhata Samhita, from Tripathi, from Ashtanga Hridaya, and from the Charaka Samhita. Thank you.
Thank you, Dr. Mrunali. It was a comprehensive presentation. So next I invite Dr. Radhika Amar Patil.
Good evening.
Good evening, doctor. You're audible.
Yes. Can you share the screen, please?
Sure, doctor.
One second, doctor.
Okay.
Dr. Radhika, please start the session, doctor.
My presentation topic is menopause, the Ayurveda review. Next slide. Introduction. The permanent cessation of menstruation at the end of reproductive life due to loss of ovarian follicular activity is called as a menopause. There is no detailed description as a disease or symptoms described in Ayurveda as a menopause. Next. Next slide, please. Need of study in modern science, hormonal replacement therapy, that is HRT, along with multivitamins and oxidants is only alternative for menopausal syndrome. But this treatment comes along with secondary health complications like vaginal bleeding, breast cancer, endometrial cancer, etc. Next slide. In Ayurveda, the context of menopause is depicted as Jarapakva Avastha of body and Rajanivrutti. According to Acharya Sushrut and various other references, 50 years is mentioned as the age of Rajanivrutti. Next slide. Dosh predominance. Menopause is linked with Vata dosha, dominated stage of life. Therefore, symptoms in menopausal phase like insomnia, anxiety, urinary symptoms, osteoporotic changes are due to dominance of Vata dosha. Along with that, Pitta dosha symptoms like hot flushes, irritability, etc. are seen during this phase. To combat the degenerative process of the body tissue, Acharyas have described Rasayan Chikitsa. Next slide. Pathophysiology. The dominant Vata dosha, especially with Laghu and Ruksha guna, results in reduction in Dravata of Rasa Dhatu. This further leads to Dhatu Kshayata, starting from Rasa Dhatu. Further, respective Upadhatu Kshaya takes place, thus leading to Artavnasha, that is amenorrhea. The whited Vata dosha also disturb the other Sharir as well as Manas dosha, Raja and Tama guna, leading to various psychological disturbances. Next slide. Samprapti of Rajanivrutti, increased Vata dosha leading to Dhatu Kshayata and that leading to Upadhatu Kshaya, that is Artav Kshaya, affects the Manas guna, Raja and Tama guna, that leads to psychological disturbances. Next slide. Management. Ayurvedic drugs having properties of Rasayana, Vatshaman, Kapha, Vardhan can be helpful in the management of menopausal syndrome. Next slide. Internal medication can taken as Dasham, Bala, Shatavari, Ashwagandha, Chandrashur, Yashtimadu, and Gokshur. Next slide. Along with that, we can take Ashwagandha Gruta, Shatavari Gruta, Rason, Shirpak, Brahmi Gruta, Saraswata Arishta, and Chavanprash. Next. Under Panchakarma, we can give Snehan, Svedan, Shirodhara, Basti, and Nasya. Other yoga, exercise, pranayam, and Surya Namaskar can advised as a in menopausal syndrome. Conclusion: menopausal symptoms generally occur due to disturbed Vata dosha. Dhatuksha is responsible for Vata Vruddhi, and vitiated Vata dosha affects various systems in woman's body. From the above theory, we can conclude that various Ayurvedic drugs having properties of Rasayan, Vatshaman, and Kaphavardhan, along with Panchakarma, Sadvrutta, balanced diet, and yoga meditation can be helpful for the management of menopausal syndrome. Thank you.
Thank you, Dr. Radhika. So next, let me call upon Dr. Kiran Dipak Kashid. I invite Dr. Kiran Dipak.
Yes, ma'am. Hello, ma'am.
Doctor, you are audible.
Hello, ma'am. Am I audible?
Yes, doctor, you are audible.
Ma'am, can you please share my PPT?
Yes, doctor.
Hello, Dr. Kiran Kashid. Hello, doctor.
Yes, sir.
Please start the session, doctor.
Okay. Good evening, everyone. Myself, Dr. Kiran Dipak Kashid from SMBT Ayurveda College and Research Institute, Dhamanga, Vigatpuri, Nashik. Today is my case presentation on Bhagandar management by Shar Sutra under the guidance of Dr. Shilpa Bade, Guide and HOD of Shalyatantra Department. Next PPT, please. So introduction. Thank you, sir. The word fistula is derived from Latin word reed, which means a pipe of fluid. A fistula-in-ano is an abnormal tract which has an external opening in the perianal skin and the internal opening in the anal canal or the rectum. And this tract is lined by unhealthy granulation tissue. When Vedna-yukta shov, that is a painful swelling, is formed in a Guda Pradesh within the vicinity of two angula, which becomes pakwa and causes daran in a Bahya Guda and Basti Pradesh, then it is called as Bhagandar, that is fistula-in-ano. Prevalence of fistula-in-ano is considered second to hemorrhoids among all anorectal abnormalities. Next slide, please. This disease causes discomfort and pain to the patient, which creates problem in routine work. As the wound is located in anal region, which is more prone for infection, thus take a long time to heal and condition remains troublesome. Operative procedure often leads to complications like recurrence and incontinence. The treatment of fistula-in-ano is always challenging situation for both surgeons as well as sufferers too. To overcome such a complications, Ayurveda is explored. Acharya Shushruta gave various treatment approaches for Bhagandar. One such a technique is Kshara Sutra, which was later elaborated by Acharya Chakradatta. The method of preparation of Kshara Sutra along with its application has been narrated in Chakrapani Tika and Rasatarangini. Acharya Shushruta has mentioned that Kshar is the best among all surgical and parasurgical measures. Kshar prepared with his method is said to have 3 doshagna property because it is prepared with many drugs. The principle of Kshar Sutra is to maintain adequate drainage and tract as well as excise tract gradually. Kshar Sutra proven as the boon for the treatment for the fistula-in-ano. Here I am presenting my case, a 32-year male patient complaining a boil near anus, on and off pus discharge from that boil since 1 year. But this condition is aggravated since 1 month. Per rectal examination reveals a fistula with external opening at 11 o'clock position with the internal opening in anus. Next slide, please, sir. Here I have given the MRI fistulogram suggestive of linear intrasphincteric fistula without secondary tract or abscess, formation suggestive of grade 1 fistula-in-ano. I also have given the preparation of Kshar Sutra. Kshar Sutra was prepared by the standard methods and guidelines using Apamarga Kshar, latex of Snuhi, Haridra powder, and linen thread number 20. Next slide, sir. Procedure. Patient was made to lie in a lithotomy position under all aseptic precautions. After Lord's anal dilatation, probing was done and Kshar Sutra was tied with a moderate tightening. Patient tolerated the procedure well. There was no PR bleeding. Dressing was done. Thread changed once in a week. Patient was prescribed with the internal medications for 2 weeks, like Gandhak Rasayan for 2 tablets 2 times before meal, Sukshma Triphala 2 tablets 2 times before meal, Gandharva Hritaki Churna 2 gram with lukewarm water at bedtime, and external application Dattedi Tel has been prescribed. Sitz bath also advised twice a day and buttermilk morning and night. So results. Patient had no pain, boils and pus discharge when I have examined patient after 8 weeks of Kshar Sutra. Discussion. Next slide. Thank you, sir. Kshar Sutra is a hallmark of Ayurvedic surgery in present era. Kshar Sutra is probably one of those modalities in Ayurvedic surgery which has gained popularity and acceptance globally. Ideal surgical treatment for anal fistula should aim to eradicate the sepsis and promote healing of the tract, which listing the preserving the sphincters and the mechanism of incontinence. Virechan is the initial line of treatment mentioned by acharyas for the treating Bhagandar. Once the tract got obliterated due to Kshar, Virechan Karma was planned to remove the vitiated drugs. Gandhak Rasayan and Sukshma Triphala helps post-operative wound healing and found equally effective in preventing the secondary infection, as the secondary infection is high because of the presence of discharge from the tract till the thread is in situ. Avgaha sweat, that is a sitz bath, promoted relaxation of anal sphincters and also relief from the soreness, burning, and inflammation. Do's and don'ts. Sushruta has advised that even after healing of fistula's wound, the patient should avoid heavy exercise, sexual intercourse, riding on animals, and heavy food for 1 year. These are activities which are directly and indirectly have effect on anal region and therefore can lead to recurrence, an area which is often ignored in contemporary science. Conclusion. The case of fistula have been raised in few decades. Kshar Sutra therapy is a radical cure in the treatment of Bhagandara without complications and recurrence. Kshar Sutra therapy can be done in a small setup with a minimal equipment and instruments. The patient remains ambulated during the whole course of treatment. It is simple, safe, and sure shot treatment for anal fistula. Bleeding during the procedure is minimal. I have given the references from Sushrut Samhita, Avarniya Adhyay, Charak Samhita, Chikitsa Sthan, SRB manuals, sinus, and fistula. Such kinds of references I have used for the preparation of my PPT. Thank you, sir.
Thank you, Dr. Kiran Deepak. So next we have a poster presentation. I invite Dr. Pavithra Jaivarshaa for the poster presentation.
Good evening, ma'am. Am I audible?
Good evening, doctor. You are audible. Please share the screen.
Ma'am, can you please share it for me?
Sure, doctor. Dr. Sabin.
Hello, Dr. Pavithra.
Yes, sir.
Please chat, doctor. Is the screen is visible, doctor?
Yes, sir.
Okay, doctor. Please chat.
But it's not visible completely. Shall I start my presentation?
Sure, doctor. Please chat, doctor.
Yeah. Good evening, one and all present. Today, my topic, I'm going to present a poster on Shashti Upakrama under the guidance of Dr. Devyani ma'am. I'm from Mahatma Gandhi Ayurvedic College, Department of Shalya Tantra. Shanmulo Ashtaparigrahi Panchalakshanam Lakshitaha Shashtya Vidanair Nirdishtair Chaturdihi Sadhite Vrana. Wound has 6 root causes, 8 basic locations, characterized by the Panchalakshan, prescribed with 60 therapeutics and managed by the 4 winds. So Acharya Sushrut has mentioned in Chikitsa Sthana chapter 1 an elaborate management of wound mentioning the Shashti Upakrama. And in Ama Pakvayeshaniyam, a Saptopakrama has been explained for the management of Vrana Shoka, which includes Vimlapanam, Avasechanam, Upanaham, Patanam, Shodhanam, Rupanam, and Vaikratavam. In Sushrut Chikitsa Sthana chapter 1, Shofa Chikitsa, Acharyas also mentioned the 11 procedures from Apatarpana to Virechana, which acts as Shopahara Karam. So going to Shashti Upakrama, the first is Apatarpana. It is considered as the Adi Upakrama and Pradhanathama in Sarva Shofa condition. And Alepa is the next one, which is also considered as an Adi Upakrama and Pradhanathama. Alepa, 3 types are mentioned, Alepa, Pradeha and Pralep according to Acharya Sushrut, and 10 types according to its karma by Vridha Pagbata. Alepa has the karma of Prahladana, Shopahara and Shodhana. The third measure is Parisheka. It is done to pacify the heat of the dosha, and the drugs are chosen according to the predominant dosha. Next is Abhyanga. Abhyanga is done prior to Svedana and Vimlapana, and it is done to oint the wound and maintain the moisture. Next is Svedana. It is done when the wound is associated with pain, Daruna and Katina type of ulcers. And next is Vimlapanam. Vimlapanam is dissolving the swelling by pressing slowly with bamboo tube, arm, sole or thumb of the fingers. And it is done after the Snehana and Svedana karma in wounds which are hard, mildly painful, and which is associated with Shota. So the karma from Apatarpana until Vimlapanam can be correlated with the Vimlapana karma mentioned in the Shokahara Chikitsa. The next one is Upanaha, the seventh Upakrama is Upanaha. It is done to without the type of wound to get Shamana karma and without the type of wound to attain Pakatva. The eighth measure is Pachanam. It is adopted when Apatarpana to Virechana has not subsided the wound. Sour agents with Ghrita and Lavana are mixed and made as at Utkarika, and it is applied on the wound and covered with Eranda Patra. It is done basically to cause suppuration. So the Upanaha and Pachana measures can be correlated with the second Upanaha of the Vrana Shofa Chikitsa. The ninth one is Visravanam. Visravanam is done to relieve pain, suppuration, and it is also indicated in poisonous wounds. The 10th Upakrama is Snehana. It is the intake of Snehana Dravya in wounds in patients who are subjected to more consumption because of chronic wounds. It is done after the assessment of Agni. The 11th measure is Vamana. It is indicated in Kafaja predominant wound, and the 12th is Virechana. It is indicated in Pittaja Vrana when it is associated with Anubandha Vata and also in chronic wounds. So the measures from Visravana to Virechana can be correlated with the Avasechana karma in the Vrana Shofa Chikitsa, where the main purpose is the drainage of the wound. The next one is Chedana. The 13th till to the 21st measure, that is Chedana incision, Vedana excision, Dharana tearing, Lekana scraping, Eshana probing, Aharana extraction, Vyadana puncturing, Sravana drainage, Sivana suturing. These are nothing but the Ashtaveda Shastra karma along with the Dharana karma. So what is Dharana karma? Dharana karma is indicated in weak patients, in wounds which are over the marama spots and wounds which have to get paka. Dharana dravyas are mixed with shara and local application is done, and it is basically indicated in superficial wounds. So from the 13, that is the Chedana karma to Sivana karma, can be correlated with the Patana karma of the Vrana Shofa Chikitsa. It is the surgical procedures adopted in open wounds. The next one is Sandhana. Sandhana karma is indicated in wounds which are wide and where suturings are contraindicated. The 23rd measure is Pidana. Pidana is done, it is the squeezing of the wound which is done to let the pus out. The 24th measure is Shonita Stapan. As Acharyas mentioned in Sutra Sthana, Shonita Varniyam Adhyayam, Sandhana, Skandana, Dahana, and Pachana are the Shonita Stapana measures used. The 25th measure is Nirvapana. Nirvapana is cooling measures. It is indicated in wounds which are vitiated with Pitta and Rakta, and milk or ghee can be used for Nirvapana karma along with the cooling drugs. 26th measure is Utkarika. Utkarika is done when wound has decreased granulation, thin discharge, non-separating, and has pricking pain and hard. The next is Kashaya. The indication of Kashaya is for Shodhana karma in foul-smelling and slimy wounds. The 28th and 29th measure are Varti and Kalka. Both are indicated in wounds with small openings and which has very little granulation in them. The 30th measure is Sarpi. Sarpi is indicated in wounds which are predominant in Pitta and needs Vrana Shodhan and Ropan action. Generally, drugs are mixed with Karpasi and it is used along with Sarpi. The 31st measure is usage of Thaila. Tila Thaila along with Sarshapa Thaila is used. It is basically in dry Vataja wounds for Shodhana and Ropana karma. The 32nd measure is Rasakriya. It is indicated in dry wounds, and the mentioning of Kasisa, Manashila, and Tutta is indicated, has been mentioned in the Rasakriya karma. The 33rd measure is Avachurnana. It is the dusting of Shodhaka and Ropana Dravya in superficial wounds. The 34th measure is Vrana Dupan. It is a ghee smeared cloth with Dupana Dravyas, and it is indicated when the wound is severely painful, discharged, and burning in nature. So the karma from Sandhana till the karma of Vrana Dupana, that is, all the measures can be correlated with the Shodhana and Ropana measures indicated in the Vrana Shofa Chikitsa. And all these measures, the drugs can be used according to the dosha and the availability of the season. The next parts of the Shashti Upakrama is called as Vaikratapaham or scar remodeling. The 35th measure is called as Utsadana. It is indicated when there is increased granulation in the wound. It is indicated to increase the granulation in the wound. The measures adopted are like consumption of meat and balya dravyas. The 36th measure is Avasadana. It is done to decrease the granulation of the wound. Usage of honey for local application has been mentioned by Acharya. 37 is the Mridu Karma, that is the softening of the wounds. It is indicated in wounds which are hard and very dry. And 38 is the Daruna Karma. It is hardening of the wound which has very less granulation tissues. And the 39th is Shara Karma. It is indicated in chronic wounds, hard wounds which are associated with itching. And it can be correlated with the Brana Granthi, that is keloid. And 40th measure is Agni Karma. It is indicated in bleeding wounds. And 41st measure is Krishna Karma. Krishna Karma is blackening of the wounds which has left a very white or pale scar. In this, Ballataka along with Gomutra has been used as topical application. The next is Pandu Karma. Pandu Karma is whitening measures in scars which has attained very blackish color. Use of Kapista fruit, Kasisa have been mentioned for Pandu Karma. The next one is Roma Sanchana. It is for increasing hair growth or repilatory agent. Hastidanti Mashi has been indicated in that. And the next is Loma Harana. Loma Harana is repilatory, that is decreasing the hair, cutting measures. And in this, the usage of Ballataka oil, Snuhi latex, etc. have been indicated. So the measures starting from Utsadana and ending the Loma Harana can be correlated with the Vaikritapaham aspect. Vaikritapaham is the Ayurvedic concept of scar remodeling. Next is the 46th measure, that is the Basti Karma. It is indicated in wounds situated in inferior extremity, in Dhakna, and wounds which are increased with Vata. 47th is the Uttara Basti. It is vaginal douching. It is indicated in wounds near the vaginal region, and it's also in menstrual disorders. The 48th method is Bandha. Bandha is the bandaging technique. The 14th bandaging technique mentioned by Acharya Sushrut and the extra Utsakini mentioned by Acharya Bhagvat can be used according to the shape, anatomical location of the wound. And Bandha has to be changed according to the seasons. And the 49th is Patra Dana. It is application of lathe and wrapping the application with a specific patra according to the dosha involved. It is generally indicated in dry wounds and which are very non-progressive in nature. The 50th measure is Grimigna. Lepa or Dhupana with Surasadi drugs have been mentioned by Acharya. Next is Brimhana. Brimhana is chronic emaciated patients. Brimhana karma is indicated, and it is done after the protection of Agni, similar to the Gritapana. And next is Vishagna. Vishagna karma is indicated in poisonous wounds. And then Jalauka Vacharana is also indicated in these types of Vishagna, in the Visha generated wounds. The next is Shiro Virechana, Nasya, and Kavala Dharana, and Dhuma. All these codes are indicated in wounds which are situated in Urdha Jatru Vikara and which are chronic in nature. Next is Madhusarpi. Madhusarpi is application of honey and ghee as topical agent. It is generally indicated in Sadhyo Brana. Next is Yantra. Yantra is instrumentation which are used in wounds which are associated with foreign bodies. And next is Ahara. Ahara includes the Patya, which is included for wound like Lagu, Ushna, Snigdha Ahara. And the last one is Rakshogna Karma. Rakshogna Karma is the following of Sadvrita. So Vrinati Asmat Ruro Api Vrana Vastuna Nashyati Adeha Dharanat Tasmat Vrana Ityuchate Buddhahi. So if we do not follow proper management of wound, scar will be present in the person lifelong. And all the Shashti Upakrama can be correlated as Purva Karma, Pradhana Karma, and Paschar Karma according to the staging of the Vrana. Thank you.
Thank you, Doctor. So next I invite Dr. Diksha Sonwane.
Hello, ma'am.
Hello, Doctor.
Good evening, ma'am.
Good evening,
Am I audible,
Doctor.
ma'am?
You are audible.
Yeah. Can you please share my screen?
Yes, Doctor.
Hello, doctor.
Hello, sir.
Please, sir, doctor.
Okay, sir. Hello, everyone. My name is Dr. Diksha Sonwane. My title name is Conceptual Study of Amla Pitta with the help of Patya Patya. My guide name is Dr. Surya Kiran Wag, sir. He is the professor and HOD of Kai Chikitsa Department, YSC Kodoli. Please next, sir. Abstract. In a present scenario, due to modern lifestyles and the food habits, most of the population are suffering from a common disease called as the Amla Pitta or gastritis. Ayurveda is a treasure of knowledge. Ayurvedic science helps for removing root cause of disease with the help of various Shodhan, Shaman, treatment along with the Patya Patya. After treatment of disease, if proper Patya not followed, the recurrence of the disease occurs. In Ayurveda, medicines as well as the Patya has equally important. For each disease, different Patya described in a Samhitas. In present, we will discuss about the importance of Patya and Apatya in Amla Pitta disease. Amla Pitta is one of the Annava Srotas disease caused due to not following proper Patya. It is characterized by the qualitatively and the quantitatively increased Amla Guna of Pitta. The cardinal classical clinical feature of Amla Pitta are Avipaka, Klama, Utklesha, Tikta Amlodgara and bitter, Rutkanta Daha and Aruchi. In Patya Kalpana, not only hitters but proper follow of Dinacharya and Rutucharya are important. Here, attempted has to be made for various Patya and Apatya are applicable for Amla Pitta. So next. Introduction. Amla Pitta is a disease which is commonly found in almost all the parts of world. Amla Pitta is a disease of Annava Srotas. For Annava Srotas, Agni plays an important role in the development of the disease. Roga Harsha Mandagni, stated by Acharyas. Here, Mandagni is the responsible for development of Amla Pitta. Due to variations of Agni, Prakrut Pachak Pitta Avastha gets converted into the Vikrut Pachak Pitta Avastha, give rise to the Amla Pitta. Due to alterations of the food habits, changing lifestyles, addition of drug, night cultures, and the mental stress hampers the process of the indigestion, and hence disease like Amla Pitta produce. In present era, the role of Patya Patya are very important. Patya is referred to the Ahara and Vihara, which is cause pacification of disease, where apathy is referred to the Ahara and Vihara, which cause aggregation and the complication of the disease. According to the Yoga Ratnakar, Ahara, Aushadhi, Patya has the same importance during the treatment. As per him, if we take medicines and doesn't follow the proper Patya, then disease got increased. The incidence of disease increased due to not following proper Dinacharya and the Rutucharya. Next slide. Aims and objectives. Role of Patya Patya on Amla Pitta. References from the various Ayurvedic Granthas. Next slide. Materials. Definition. Amla Guna Udrikattam Pittam Amla Pittam. It is when there is an increased Amla Guna of Pitta Dosha. The condition is called as the Amla Pitta. First one is the Nidan Panchak. Nidan. It is the disease of Annava Srotas. The dietary factors plays a predominant role as etiological factors. First one is the Ahara Hetu. Guru Abhishandi Ati Ushna Parushrita Ahara Adyashana Ajirna Anashan Viruddhashana Kulatta Lavana Rasa, Amla Rasa are the responsible for the formation of Pitta Vyadhi. Then Viharaj Hetu, Vega Vidharan, Deva Swap, Atapa Sevana, Ratri Jagrana, Ushna Sevan are included in the Viharaj Hetu. Manasik Hetu. This Hetu also plays an important role in the production of the Amla Pitta, like Chinta, Krodh, Bhaya, Shoka, Dvesha, Matsara are included under the Manasik Hetu. Next slide. Purva Rupa. Acharya Charak considered Amla Pitta as a symptom of the disease. During the descriptions of the Grahani, he mentioned Purva Rupas like Trishna, Alasya, Balansha, Annavida, etc. These symptoms also can considered as a Purva Rupa for Amla Pitta. And third one is the Rupa. Acharya Charak in a Grahani elaborates concept of Amla Pitta. He mentions the Lakshanas of Amla Pitta as Avipaka, Klama, Utklesha, Aruchi. This has been considered as the Samanya Lakshanas of Amla Pitta by the most of authors. Fourth number is the Samprapti. Kashyap explained that the Nidan caused the Dosha Prakopak, especially Pitta Dosha. Here mostly Amla and Drava Gunatmak Pitta increased. This leads to Mandagni and variations of doshas situated near the Amashay. Here formation of Amavisha takes place due to the Amavish indigested food becomes Vidagda and Shukti Bhava. These Vidagda and Shukti Bhava food create Amlata in Amashay and travel all over the body, produces symptoms according to the involvement of the dosha and vrati. The next slide. This is the tree diagram. Hetu 7, 3 points: Aharaj Hetu, Viharaj Hetu, Mansik Hetu, and the Agantuj. It happened how Amla and Drava Guna of Pitta increased. Then Jataragni Mandata, in a Sanchay, there is a variations of Saman, Vayu, Pachak Pitta, and Kledak Kapha. Then Ama Annavisha in the Prakop, Vidagda Kop and the Shukte Paka. In the Prasar, there is a vitiated doshas travel all over the bodies. Then Sthana Samshray produces symptoms like the Hastapada Daha, Rutkanta Daha. Then in Vyaktigat Bhav, there is Amla Pitta. Amla Pitta has two Bheda, Urdhvagat Amla Pitta and the Adhogat Amla Pitta. Next slide, please, sir. Veda, Urdhva Amla Pitta, Vegas of Pitta expelled out through Urdhva Jatrugat or upward directions called as the Urdhva Amla Pitta. Second one is the Adhog Amla Pitta. Vegas of Pitta occurs from the downward orifice called as the Adhog Amla Pitta. Then Chikitsa, various Shodhan process like Vaman, Virechan, Basti, Rakta Mokshan, and Shaman like the Sudshekar Ras, Avipattika Churna, Kamduda Ras, Lakshmi Vilas Ras are described for the Amla Pitta. Then we are going towards the Patya. This is not only cured with only Shodhan and Shaman medicines, but also Patya plays an important role. Acharya described Patya related to the Amla Pitta are. Next slide, sir. Then various patyas for Amla Pitta disease mentioned in the Sahitas. Anna, Ahar Dravya is Puran Shali, Rasa is a Madhura, Virya Shita, Vipak is a Madhura, and Guna is a Laghu. Its Karma is a Vata Shamak. Then the second one is a Yava. Its Rasa is a Kashaya Madhura Tikta, Virya is a Shita, Vipak is a Katu, and it's a Agni Deepanam. Second one is a Godhuma. Madhura Rasatmak, Shita Viryatmak, Madhura Viryatmak, and Guru Snigdha Gunatmak. Its karma is a Vata Pittahara, Balya, Jivana, Bruhana. Then Mugdha, Madhura and Kashaya Rasatmak, Shita Viryatmak, Katu Vipakatmak, Laghu and Ruksha Gunatmak, and it's a Kapha Pittahara and Vatakara. Then in the Kshira Varga, Ahar Dravya is a Godugdha, Rasa is a Madhura, Virya is Shita, Vipak is Madhura, Guna, Guru, and Snigdha. It is a Tridoshahar and a Shrotahar. Then Shaka Varga, in Ahara, Patola, Patola Rasa is a Tikta and Katu, Ushna Viryatmak, Katu Vipakatmak, Guna is a Laghu and Ruksha, it's Agni Deepan and Kapha Pittahara. Then Mamsa Varga, Jangala Mamsa, it's a Madhur and Kashaya Rasatmak, Shita Viryatmak, Laghu Gunatmak, and Agni Deepan. Then in Phala Varga, Dadima, Madhura Kashaya Amla Rasatmak, Anushna Viryatmak, Madhura Vipakatmak, Laghu, Snigdha, and Tridoshahara. Next slide, sir. Navana, it's a Madhura Rasatmak, Shita Viryatmak, Madhura Vipakatmak, and Guru Gunatmak. कफकारक. Then Masha, Rasa Kashaya, Virya Ushna, Vipak Madhura, Guru Gunatmak and the Snigdha, Kafakara. Then Madhya Varga, Nutana Ahar and Madhya, Rasa is Amla, Ushna Viryatmak, Madhura Vipakatmak, Guna is a Laghu, Vishada Tikshna. Then Khanda Varga, it's a Aloka, Madhura Rasatmak, Ushna Viryatmak, Madhura, and it's Karma is a Vaptaka. Hello.
Hello, doctor.
Can I audible, sir?
Doctor?
Yes, doctor.
Hello,
Yes,
sir.
doctor.
It's disconnected, sir.
Please continue, doctor.
Yes, you can.
Okay, sir. Then 8 number is a dinacharya. In a dinacharya refers to the recommendations of persons daily routine that educate how to live happy and healthier life and avoid all the disease. It is also helps in a proper digestion, absorption, assimilation of food, which is necessary for reducing manifestation of the disease. Activities include under dinacharya is a brahme muhurte uttishtite, malotsarga vidhi, dantadhavan, jiva nirlekhan, anjananasya, kavala, धूमपान, अभ्यंग, व्यायाम, उदवर्तन, स्नेहन, भोजन विधि, etc. Rutucharya. Rutucharya means the seasonal diet, lifestyle in a short seasonal routine needs to follow the according to particular season. In Ayurveda, 6 types of season were mentioned, and for each season described particular patya which is necessary for healthy digestion. In today's era, due to vigorous changes in lifestyles and not following season recommendation, evidence of amla pitta increases, so it is necessary to follow seasonal diet to reduce the disease. The next slide. This is the chart for indication of rasa and guna as per the rutu. Rutu, indications of rasa and guna. Shishira, madhura, amla, lavana, snigdha, ushna. Vasanta, katu, tikta, kashaya, ruksha, ushna. Grishma, madhura, amla, lavana, shita, drava, snigdha. Varsha, madhura, amla, lavana, katu, snigdha. In Sharad Rutu, madhura, tikta, kashaya, and shita and lagu gunatmak. Hemanta, madhura, amla, lavana, ushna, snigdha. Next slide, sir. Discussion. Amla pitta is a disease of Annava Srotas. So Aharaj Hetu plays an important role in present era due to hurry, worry, curry and constant excessive consumptions of alcohol, tobacco, beverages, fast food, junk food leads to improper follow of patya, which hampers process of digestion, causes local irritation in stomach, cause amla pitta. In classic acharyas mentioned, patya 7 has been correspondingly important as Aushadha 7, and both are effective in prevention as well as the management of complications of the disease. According to the Acharya, Charak, almost all the disease can be divided into 3 steps. First one is the Nidan Parivarjan, Prakruti Vighatak, and Apakarshanam. Nidan Parivarjan states that avoiding these factors from the diet, which are dosha aggregating and disease producing Nidan Parivarjana, is the first line of treatment of the disease. The disease is mostly due to the apatya sevan, so avoiding of these factors are important here. For Amla Pitta, Patya describe process properties like the Laghu Ruksha Gunatmak, Tikta Madhura Rasatmak, and Shita Viryatmak Gunas. The Gunas having the properties exactly opposite to the Pitta doshas, and they described as a Patya. Next slide, sir. Dietary precautions is necessary in the case of Amla Pitta. Eat meal when there is a proper sensation of hunger. Don't eat meal when before the digestion is previous meal. Acharya says stomach is divided into three parts. One for food, one for water, and last one is empty for proper digestion of food. Eating heavy food material leads to slow digestion and require much more time to light. Healthy diet necessary to improve conditions. Not only Hetu Sevan but also proper follow of Dinacharya and Ritucharya are equally important. Principle of Dinacharya is more relevant in a present era because everybody is hurry and running according to the fast lifestyle. Even nobody has time even for themselves. So the evidence of lifestyle disorder like Amla Pitta got increased day by day. According to the Ayurveda, one should follow Dinacharya in order to lead the healthy and disease-free life. Dinacharya includes many regimens, out of which Bhojan Vidhi includes follow of Ashtavida Ahar Vishayatan and Ahar Vidan. If this is not kept to proper disturbance of Agni occurrence, create Agni Mandya and produces Ajirna, leads to formation of Amavisha. This Amavisha gets mixed with the doshas, mainly Pitta dosha. Pitta doshas gather in Amashay leads to manifestation of the disease like Amla Pitta. As we know, the Pitta accumulates in the Varsha Rutu and raging in the Sharad Rutu and back to the normal stage during the Hemant Rutu. With help of this knowledge, we are able to prevent disease produced by the Pitta dosha. Amla Pitta is a result of not following a proper seasonal changes, but with the knowledge of the Rutucharya, we can surely avoid these of the practicing regimen in accordance with the Rutu to maintain the harmony of doshas with the produces disease. Next, sir. Conclusion. Amla Pitta is most burning issue all over the world due to high prevalence rate, vast field of manifestation of symptoms. If not treated in appropriate time, create major problems. Relapse are very common. Proper follow of Patya and Apatya in accordance with the Dinacharya and Rutucharya is necessary. Next. These are some references from Sartha Vagpat, Madhukosh, Tripathi, Sharma. Next, sir. Thank you, sir.
Thank you, Doctor, for this broad and comprehensive presentation. So next I invite Dr. Devyani P. Dasar for the paper presentation.
Am I audible, ma'am?
Yes, Doctor, you are audible.
May I share?
Sure, Doctor, please.
Is it visible, ma'am, PPTs?
Yes, Doctor, it's visible.
Is it moving? Is
Yes,
slide
Doctor,
is going
it's
to
not-
change?
Yes, it's moving now.
Okay, yeah. Thank you so much. So good evening, one and all. This is Nagara National Seminar on 23rd January 2023. So my presentation title is Role of Churna Therapy in Dhanusandhigat Vata with special reference to osteoarthritis, a clinical study. Myself, Dr. Devyani, Associate Professor from Department of Chalyatantra of Mahatma Gandhi Ayurveda College, Hospital and Research Center. It is a constituent unit of the Tambat Institute of Medical Sciences, Wardha. These are the clinical study prospectus having introduction, aim, objectives with the methodology, observation and results, finally discussion and conclusion. So Sandhigat Vata, we know very well that Shula Pradhana Vedana Vata Purna Drudi Sparsha and pain in the movement. So lack of all the movements at the knee joint also occurs after the age of nowadays from the 35 years of age, and it is a most common form of the joint disorder. Having this modern treatment availabilities like injectables, high table osteotomy, joint replacement surgery, and as per Ayurveda, according to the Acharya Sushruta, he said about Sneha, Upnaha, Agni Karma, Bandhana, Mardana, Snayu Sandhi, Asti Samprapte Kuryata. These are the references. So aim is the assessment of an effect of Jalokachana in Janusandhigat Vata with the objective to study the effect of Jalokachana in Janusandhigat Vata with special reference to osteoarthritis. These are the case summary having the male and female patients up to the age from 40 to 60 years of age, also having the complaints of pain, swelling, difficulty in the joint and difficulty in the movement, and there is no any systemic disorders. Also, there is no any long use of any medications. So this is the methodology that Jaloka Churna done weekly once for 6 weeks, having these materials, Jaloka, turmeric, and other the related materials with the follow-up of 2 weeks. So these are the results that is found most efficacious parasurgical procedure in this trial, having this leech application on the knee joint. So these are the statistics related results that showing here that according to the age and the gender, incidences are 35 means 30 to 40, 40 to 50, 50 to 60, and above the 60 that are 35, 20, 25, and 20% respectively, with having this male and female ratio in front of you. So now coming to the discussion area. So highly significant result in means according to the statistics, a highly significant result in reduction of the pain of the knee joint, also swelling and tenderness. Marked improvement seen in the 6 patients with the moderate improvement in 4 patients, and remaining are improving. The discussion is a repeat. It's a rapid reduction of a pain there, and it's very effective treatment. Also can reduce the symptoms of osteoarthritis, very significant in improvement of functional recovery of the knee joint, and has the potential of being additional or alternative treatment for the osteoarthritis, which is a very alarming complaint nowadays. So the conclusion, Jaloka Churna is found effective in Janusandhigat Vata. It may inhibit definitely the joint replacement surgeries and other surgical corrections with the high tibial osteotomy, and is to do also cost effective than other surgical corrections. These are the references. Practice makes perfect, but research makes it refined. Thank you. Thank you for giving this chance to me. Thank you, all of you.
Thank you, ma'am. Thank you for this informative session. So next I invite Dr.Rameshwari Ramesh. I invite Dr. Rameshwari Ramesh.
Hello, ma'am.
Hello, doctor.
Hello.
Yes, doctor, you're audible.
Yes. Can you share my PPT, please?
1 second, doctor.
Yeah.
1 second, doctor. Dr. Rameshwari, please start, doctor. Please start the session, doctor.
Good evening, everyone. Next slide, please. Now I'm presenting my paper presentation. My name is Dr. Rameshwari. My guide name is Dr. Deepal Swami. She is Professor of Chikitsa in Kodavli. My paper presentation title name is Conceptual Study of Pathology of Pneumonia, Shwasanak Jwar in Modern and Ayurvedic Perspective with Case Presentation. Next slide. Abstracts mentioned here. Next slide. Introduction. Pneumonia is an abnormal inflammatory condition of the lung. It is an often characterized and including inflammation of a parenchyma of the lungs and abnormal alveoli filling with fluid. Shlok here mentioned. It is an inflammatory condition of the lungs that is caused by microbial agent. Pneumonitis is a general term that describes an inflammatory process in the lungs tissue that may be principle of a patient to place a patient at the risk of microbial invasion. It is the leading cause of the death from the infectious disease, and at the end of breathing tubes in your lungs and a cluster of tiny air sac. If you have pneumonia, this tiny sac become inflamed and fill up with. Next slide. Aims and objective: to understand pathology of a pneumonia in a modern and Ayurvedic perspective, to understand modern treatment and management of pneumonia. Literature of review. The Vedas are a large body of religious text of originating Asian India, composed in a Vedic Sanskrit. The text constituent oldest layer of a Vedas. It is considered as oldest authentic manuscript ever found. Veda narrates medical science very lucidly. Madhav Nidan describes scientific view of pneumonia. Shvasanak Jwar in a Madhav Nidan Parishishta, shlok number 1 and 2. Bhaishaj Ratnavali describes separately topics specific jwar pneumonia, Shvasanak jwar in a Bhaishaj Ratnavali. Symptoms of a pneumonia, Shvasanak jwar are similar to Karkatak jwar. Next, material and methodology. The paper is based on Ayurvedic text and previously published article and research paper. Ayurvedic text include Madhav Nidan, Bhaishaj Ratnavali, and Ayurvedic modern and textbooks. Information is also collected from previously released journal and article, etc. Next. Pathophysiology and Samprapti. Pathophysiology of pneumonia, gastric content aspiration, entry bacteria or virus into the lungs, and then inflammatory response, then cavity extend to bronchus, then promotion of abscess into in collapse, then increased production of a sputum, then sputum discharge, breathing shortness with a fever. And according to Ayurveda, निदान सेवन, जीवाणु संक्रमण, फुफ्फुस में अंतकोष्ठ में प्रवेश, श्वास प्रणालियों तक संचार, जीवन के वैशाली प्रभाव, रक्त से गाढ़ा होना, फुफ्फुस में शोथ, मुख्यतः फुफ्फुस के अधोभाग में शोथ होना, फुफ्फुस में रक्ताधिक्य और श्वसनक ज्वर. नेक्स्ट. Stages of a pneumonia: congestion, red hepatization, gray hepatization, and resolution. Next. Clinical features of a pneumonia: high fever, shaking, chills, shortness of a breath, dyspnea, increased breathing rate, chest pain when you breathe deeply or cough, dusky and purplish skin color from poorly oxygenated blood, fatigue and muscle aches, nausea, vomiting, diarrhea, cough, particularly cough, and productive of a sputum. And Lakshanas, shlok is here mentioned. Next. Diagnosis: chest X-ray, blood test, sputum examination, physical examination, bronchoscopy, and pulse oximetry. Next. Complications of a pneumonia: lung abscess, parapneumonic effusion, emphysema, sepsis, metastatic infection like meningitis, endocarditis, arthritis, ARDS, respiratory failure, circulatory failure, renal failure, and multiple organ failure. Next. Next slide. Management of a pneumonia: oxygenation, fluid balance, antibiotic therapy, analgesia, physiotherapy, and prevention. And according to Ayurveda, Chikitsa in Ras Tribhavan Kirti, Lakshmi Vilas, and Shwas Kuthar Ras, Vati Lavangadi Vati, Voshadi Vati, Marichadi Vati, Churna, Talisadi Churna, Madhuyeshti Churna, Kwat, Gojivadi Kwat, Bharangvadi Kwat, and Dashmuladi Kwat, Avleha, Vasavaleha, and Chavanprash. Next. Vaccination: pneumococcal conjunctivitis vaccine. This vaccine for below 2 years or 2 to 4 years in a children, and pneumococcal polycythrid vaccine they give in adult. And World Pneumonia Day in November 12th. Next slide. Now I present my case study. 33 years old female, present of a shortness of a breath on exertion, cough, fever with chills. History of a present illness. She report that she was seen for similar symptoms previously at her regular clinic 6 months ago. At the time, she was diagnosed with acute bronchitis and treated with bronchodilator, antibiotic, and short course of oral steroid. This management did not improve her symptoms, and she has gradually worsened over 6 months. Now she is admitted with cough, shortness of a breath since 6 months, but once since 1 month, fever since 4 days. Personal history: mystery addiction since 5 to 6 years, allergic no, past medical history no, physical examination. On examination,
blood pressure 130/80, pulse 80, RR 22, saturation 90% on room air, temperature 90, systematic examination, CVS S1 S2 positive, conscious and oriented investigation are here. HB 8.9 WBC platelets ESR are included here. In X-ray impression mild intestinal pneumonitis, HRCT bilateral pneumonia, and treatment emergency treatment O2 supply by nasal prong, injection paracetamol 500 mg, injection pan 40 mg, injection NSAID 4 mg, and conservative treatment injection meropenem 1 gram TDS, injection clindamycin 300 mg BD, injection pan 40 mg OD, injection MSAID 4 mg TDS, IV fluid NSRL 60 ml per hour. Okay, thank you.
Thank you, doctor. Next, I invite Dr. Darshana.
Yes, ma'am. Good evening, ma'am.
Good evening, doctor.
Please share my PPT, ma'am.
1 second, doctor.
Hello, Dr. Darshana.
Yes, sir.
Please start, doctor.
Yes, sir. Good evening, all. Myself, Dr. Darshana Sonwane, PG Scholar of Shalyatantra Department at SMBT Ayurved College, Igatpuri, Nashik. Today, the topic of my presentation is Principles of Safer Surgery under the guidance of Dr. Bade ma'am, HOD and Guide of Shalyatantra Department, SMBT, Nashik. Principles of Safer Surgery. Shushruta Acharya, Sushruta Basic Surgical Techniques with special reference to Halsted Principles of Safer Surgery. In Ayurveda, Sushrutacharya is the father of surgery. Similarly, in modern era, Halsted it is the father of safe surgery. Here, the word safe is more important. Next slide. William Stewart Halsted, co-founder of Johns Hopkins Hospital, introduced 7 principles of surgical technique regarding tissue handling. It is an ideal concept and must be followed in every minor and major surgical cases. The key benefits of these principles are minimal hospital stay, minimal post-operative care, early health recovery, and last is the cost effectivity. Next slide. The principles are as follows. First, gentle handling of tissue. Second one, meticulous hemostasis. Third, preservation of blood supply. Fourth, strict aseptic technique. Fifth, minimum tension on tissues. Sixth, accurate tissue apposition. And seventh one is obliteration of dead space. Next slide. Let's discuss gentle handling of tissue. First of all, the skin and the soft tissues need respect while making an incision. Previous slide, sir. Dissecting layers and tissues, suturing and cleaning wounds. Similarly, in Shushruta Samhita Sutrasthan 5th Adhyay, that is Agropa Hernia Adhyay, Shushruta Acharya explained ideal quality of incision, that is Vranagun, correct technique of incision, direction of incision, method of suturing, and complications of improper incision. Next. Second principle is meticulous hemostasis. Shushruta Acharya stated Rakta, that is blood, it is the 4th dosh in Sushruta Sutrasthan 21 Adhyay, that is Vrana Prashnadhyay. After making incision, Nirlohitam Vranam Krutva, that is make blood leakage free, is explained in Sushruta Sutrasthan 27 Adhyay, that is Shallapananiya Adhyay. Sushruta Sutrasthan 14 Adhyay, that is Shonit Varnaniya Adhyay. 4 principles of hemostasis was explained by Shushruta Acharya. That is, Sandhan means hot fomentation, Skandan that is apply astringent lotion. Third one is the pachan, that is coagulating local blood. And last one is dahan, that is cauterization. Next principle. Next, third, preservation of blood supply. That is proper blood supply at operative site for correct union of tissue margin is very much important. It is explained in Sushrut Sutrasthan 16th Adhyay, that is Karna Veda Bandha Vidhi Adhyay. Not try for union where there is no blood, where there is impure blood or excess or inadequate blood supply. Next slide. Fourth one is the strict aseptic technique, that is sterilization. Sushrut Sutrasthan 19th Adhyay, that is Vranitopasaniya Adhyay. Vranitagar concept was explained by Sushrut, that is well planned, well equipped, well arranged, and dhupit means fumigated by drugs. Vranitagar is important for any surgical procedure. In Sushrut Chikitsa 2nd Adhyay and Dallan commentary, surgical instrument used after Agni Taptena means heated in fire. Next. Fifth one is minimum tension on tissues. Minimum tension and avoidance of strain at incision site facilitate the healing process. Suturing neither too near nor too far to avoid cut through and pain explained in Sushrut Sutrasthan 25th Adhyay, that is Vrana Vidnyaniya Adhyay. Next slide. Accurate tissue apposition. Correct apposition of tissue margin for early union of tissue, minimum scar formation is explained in Sushrut Sutrasthan 25th Adhyay, that is Vrana Vidnyaniya Adhyay. Next slide. The seventh and the last principle is obliteration of dead space. After removal of lipoma, cyst, lump, foreign body, pus, etc., avoid dead space existence. In Ayurveda, if there is any ka, that is dead space, means ka vaigunya, kupit doshas attracted at that site and they proceed the disease. This is explained in Sushrut Sutrasthan 25th Adhyay. Abolishing dead space starts the healing from the bottom. Next. Conclusion. All the principles of Separ surgery mentioned by Halstead are surviving in Sushrut Samhita. Sushrut described the principle of Separ surgery in his own text, that is Sushrut Samhita, but not by such heading. So, it can be said that surgical ethics, surgical principles, and the soul of surgery actually follow the ancient Ayurveda principle. The Sushrut ideas prevailing subsequently many years ago, but there is basic lacuna in its advertisement on suitable modern platform. This shows that Ayurvedic surgical spirit. Thank you, everyone.
Thank you, Doctor. So next I invite Dr. Shreya Soni. I invite Dr. Shreya Soni.
Hello, Dr. Shreya Soni. Are you there?
Next, I invite Dr. Mamta Jalindhar Khatam. I invite Dr. Mamta Jalindhar.
Yes, good evening, ma'am.
Good evening, doctor.
Am I audible?
Yes, doctor, you're audible.
I'll share my screen.
Okay, doctor. Doctor, your voice is breaking.
Hello.
Yes, you're audible.
Yes, am I audible well?
Yes, doctor, you're
Doctor,
audible.
doctor.
Sometimes your voice is breaking.
Will you share PPT, please?
Sure, doctor.
So, doctor, please start the session, doctor.
Okay. Good evening, everyone. My topic name is Conceptual Study of Pathophysiology of Vatarakta and Use of Guruji in Vatarakta. My name is Dr. Kadam, PG Scholar, Department of Chikitsa from YS Kodolu. My guide name is Mr. Dr. Burakhade, Associate Professor, Department of Chikitsa, YS Kodolu. Next slide, please. So here is my abstract. A chronic disease is defined as condition which develops gradually through years because of frequent and continuous exposure to abnormal dietary, lifestyle, or environmental factors. Initially, there may be absence of disease symptoms, but later stages, complex manifestations involving one or more organs leading to derangements of bodily functions will be seen in chronic diseases. Vatarakta in Ayurveda is considered as one such chronic illness, which is commonly seen affecting nearly 14 to 17% population every year. Next slide, please. Introduction. It is caused by vitiated vata and rakta. Vitiated vayu obstructs the path of vitiated rakta in the beginning and then is vitiated by rakta further. This complete process is known as vata rakta. Types of vata rakta mainly include uttan, ambhir, and according to dosha dusha, vata pradhan, pitta pradhan, kapha pradhan, and rakta pradhan. Clinical features of vata ranges from mild inflammation and discoloration of skin to complete derangement of bodily organs depending upon its type and chronicity. Next slide, please. Aims and objectives: to understand pathophysiology of Vatarakta from different samhitas and to understand effect of Guruji in Vatarakta and studies pharmacology. Next, please. So, literature review. The Vedas are a large body of religious texts originating in ancient India, composed in Vedic Sanskrit. The text constitute the oldest layer of Vedas. It is considered as the oldest authentic manuscript ever found. Veda narrates medical science very lucidly. Charak Samhita describes scientific view of Vatarakta in Charak Chikitsa Adhyay 29. Sushrut Samhita describes scientific view of Vatarakta in Niyanstan Adhyay 1 and Vatavedi Chikitsa Stan Adhyay 5. Ashtang Hriday describes Vatarakta in Chikitsa Stan Adhyay 22. Next, please. Material methodology. The paper based on Ayurvedic tests and previously published articles and research papers. Ayurvedic texts include Charak Samhita, Sushrut Samhita, Vagbhat Samhita, Harit Samhita, and other Ayurvedic textbooks. Information is also collected from previously released journals and articles, etc. Next, please. Samprapti or pathophysiology. Now we'll see hetus. When a person takes excessive foods and exposes to lifestyle activities which emit Vat, and so is used to long distance rides on animals like elephants, camels, horses, the Vat gets severely aggravated by its own causes. On the other hand, Rakta or blood gets vitiated by the consumption of Yavana, Amla, Katu, Kshar, etc. causes. Next, please. Vatarakta mostly affects the extremities like hands, feet, and fingers. It has been emphasized in Ayurvedic classic Charak Samhita that specific etiological factors to the morbidity of the Vata dosha and Rakta dhatu. This vitiated Vat along with deranged Rakta circulates very fast all over the body due to the Sukshma and Drava guna of Vata and Rakta respectively, and undergo dosha dusha samurchana, that is pathogenesis in Sandhi sthana joints, specifically Pada and Anguli Sandhi, that is metatarso-phalangeal joint. Next. Kapha had Shita guna, coldness, and Sandhi joints are considered to be sthana of Kapha dosha. The small joints not being straight promotes the accumulation of circulating vitiated Vata and Rakta. Every time the patient indulges Tikshna, Ushna, Kshara Ahara, that is spicy, fried, alkaline food. Gout is an inflammatory response to the MSUM crystals forms secondary to hyperuricemia. Next, please. The condition is characterized by abnormally elevated levels of uric acid in the blood, recurring attacks of joint inflammation, that is arthritis, and deposits of hard lumps of uric acid in and around the joints. Next, please. Pathophysiology. Now, due to Hetu 7, there will be Vata Prokop, Rakta Prokop, and Santarpajanya Ahar Vihara. Vata Prokop will be due to Kashaya, Katu, Tikta diet, irregularity in diet, that is or riding on elephant, horse, and camel, etc. and Veg Nigraha. Rakta Prokop will be due to excessive intake of Lavan, Katu, Amla, Kshara, Snigdha, Ushna, Kula, Mishana, and Abhi trauma. That is another. Due to this, Vaddushti and Rakta Dushti takes place. Rakta produces hindrance to the passage of Vata, obstruction of Vayu by Rakta in Siras. Also, Santarpajanya Ahar Vihar causes excessive accumulation of abnormal Kapasha and Medo Dhatu, that is adipose tissue in Rakta vasculatus. Obstruction of Rakta Marga by its Pichilatva, Upalap, etc. properties.
Hello, doctor.
Am I audible?
Yes, doctor, you're audible.
I'm not able to see the screen.
Is it visible now?
No. Once again.
Hello, doctor.
Dr.
Yeah,
Mamta,
there I'm not able
it's
to see
visible.
the screen. No, not yet.
Now is this visible, doctor?
Hello, Dr. Mamta, is it visible now?
Hello, Dr. Mamta, can you hear me?
Dr. Mamta,
Hello, Dr.
please
Mamta
respond.
Jilindhar, can you hear me? Dr. Mamta, we can hear your voice. I think you have some network problem. Next, I would like to invite Dr. Aarti Harkaut for the presentation.
Hello.
Hello, doctor.
Hello. Good evening, sir.
Good evening, doctor. Your voice is clear, doctor. Please share the screen, doctor.
Okay. Can you please share my screen, please?
Okay, 1 second, doctor.
Okay, sir.
Dr. Aarti, please chat, doctor. Please chat the system.
Okay, sir. Good evening, everyone. Myself, Dr. Aarti Kunde, PGA pediatric student of SMBT Ayurved College, Dhamangao. So my today's topic is Sanskar. Next slide, please. Abstract Kamarvritta is one of the prime branch of Ayurveda. Children has also considered as the most vulnerable class of society as they are unable to express themselves dependent on caretaker. Thus, children need a special attention and nursing as a children are in a rapid continuous process of growth and development physically and mentally. In Ayurveda, various acharya describe many types of sanskar in which 16 sanskar are performed in a present era from the birth to the end in a Hindu nations. All these sanskara are performed since Vedic period. Whether we conclude logic behind it or not, it had some importance in a development of baby. In present era, there is a need to understand its effect on scientific basis and simply its concept to adopt this in a society easily, and we got the ideal baby for the society. Hence, what sanskar suggest concept of growth and development and examination of development milestone of a growing children. Next, please. Aims and objective: to study the concept of sanskara which is explained in our Samhita, to study the effect of sanskara in growth and development of child. Material and methods: the material is collected from the classical text of Ayurveda, Samhita, modern literature, etc. Next, please. Introduction. Sanskaro hi gunan antaradhanam. Any process which brings continuous positive change in a given material, physical body, intellectual capacity, and the personality is called as a sanskar. In medical science, sanskar can be defined as addition of a new qualities, skillful activities, bringing fitness, self-productive, and impression creating quality, etc. Next, please. Relation of sanskara with growth and development. In pediatrics, we have a two word with respect to the maturation of body, that is growth and development. Sanskars start from conception and continue till death, same as a development. In child, many sanskar are performed at a particular age to assess, recheck, and to recheck the expected level of development to that age and announcement of development status of the child to all the family members from time to time. Next, please. Sanskara, which can be performed in a today's era, described in Ayurveda literature, are as follow, which are divided into the three avastha of life. That is the Garbhastha avastha, Balya avastha, and Yuva Vardhakya avastha. Next, please. Importance of some sanskara and the three modern and their modern aspect in present era. Importance of Jat Karma Sanskar. This provides an opportunity to examine the baby immediately after birth. Primary immunization done by giving Swarna Prashan is also help to check the initiate sucking, rooting, and swallowing reflexes, which should exist in coordination. Next, please. Importance of Namkaran Sanskar. Naming of the baby usually occurs on the completion of 10th day or 11th day, 100th day, and 1 year. The name is described astrologically on the basis of the time and place of the birth of the child, which is indicate social and communicable condition in society has its impact on the person throughout the life by identification. First 10 days are considered as a high risk period of newborn. Baby can die within a week in case of a major congenital abnormalities, severe birth asphyxia, etc. So after completion of these periods, Namkaran Sanskar is advised. Next. Importance of Nishkraman Sanskar. According to Nishkraman Sanskar, the child is taken out of the house for the first time. After completion of the 4th month, baby taken outside and usually gets exposed to the strong rays of the sun. Hence, disappearance of a physiological photophobia and the complete development of eye and vision are the important criteria for the external exposure, which will be attained by this time. So, in Nishkraman Sanskar. Next. Importance of Annaprashan Sanskar. Dugdhapan in the 1st month, Phalaprashan in the 6th month, and Annaprashan in the 10th month. Suggest slow weaning from breast milk with an introduction of a family pad food system gradually. Secretion of pepsin, which are a main digestive enzyme. Hence, at the time of the 6th and 7th month, fruit juice, cereal water, rice water are introduced to the child. Allow vitamin C in a helpful for the absorption of iron for a hemopoietic purpose and other micronutrients to bless the child with a good digestive system. It may be helpful to produce urine and stool in a proper way. This time baby starts sitting, crawling, approaches object with one hand and transfer to the other hand. Next. Importance of Karnavedan Sanskar. Pulsing the ear lobes in 6th, 7th, 8th, and 12th month. This look like an acupuncture method. Stimulation of the adrenal gland reduces the respiratory infection. Thus, pulsing the ear, usually baby cries and vocabulary of the child can be indirectly tested as by the 7th, 8th, 9th month infant. Start verbalization word like ma, pa, da, ba, etc. Next. Importance of Chudakarma Sanskar. Chudakarma Sanskar should be done according to Manusmriti, that is first year or maximum in 3 to 5 years. This procedure is adapted for the examination of the skull, assessment of bone growth of the cranium, and to identify the deformities of the skull at the age of the 1 year. Acharya Sushrut says this procedure removes the impurities, strength, promoting and brings delightfulness, lightness, prosperity, courage, happiness to the child. Acharya Kashyap in Arunshika Chikitsa explains Mundan as the first line of treatment that time confirm diagnosis of a rickets. Next, please. Importance of Upanayan Sanskar. Upa means near and Nayan means bringing. This Sanskar performed before initiation of education or a 5th year of age. This Sanskar child will be sent to Gurukul where he studies under the guidance of a teacher. He is educated to control his emotion, anger, aggression, grief, and advised to behave maturely and responsibly. He is also educated to take care of himself, parents, and society. So this Sanskar important for the personal and social achievements of future. Next. Discussion in Ayurvedic literature, Kashyap Samhita is well known for child development and fulfillment. Acharya Kashyap specifies 16 types of the samskara, particularly from the birth to the end. Out of this, described very important are 8 samskara, which is helpful in nourishment of the baby as well as mother. Next. Conclusion. These sanskara are step points of a life from where life enters in a new phase. This sanskara establish baby and atmosphere to accomplish with the situation. Each sanskara has its own value. Many times we can prove it by observing its effect, but also quite difficult to evaluate on a subjective parameters. All these sanskars are performed since Vedic period. Whether we conclude logic behind it or not, it has some importance in development of baby. In present era, there is a need of understand its effect on a scientific basis and simplify its concept to adopt this in a society easily, and we got the ideal baby for this society. Thank you.
Thank you, Dr. Ardi, for this wonderful presentation.
Okay.
So next, let me call upon Dr. Patil Sadish Mahajan for the paper presentation.
Am I audible, ma'am?
Yes, doctor, you're audible.
Ma'am, can you please share PPT for me?
Sure, doctor.
Kapil?
Yes, sir.
Hello?
Thank you, sir.
Okay, please start.
Good evening, everyone. Myself, Dr. Kapil Satish Mahajan, PG scholar from SMBT Ayurved College, Nashik. Today, we are going to discuss about importance of blood in surgical practices, along with its Ayurvedic aspects. Next slide, please. Introduction. Sushruta is known as father of surgery. Sushrut Samhita is golden book for surgeons as it includes every detail points regarding surgery and surgical practices. Nasal reconstructions, plastic surgery, cataract, eye surgery are firstly mentioned in Samhita. Agni Karma, Shar Karma, etc. given by Sushruta. So next slide, please. Introduction. Sushrut Samhita contains in all 120 chapters. Along with Sutrasthana 46, Nidan Sthan 16 chapters, Sharir Sthan 10 chapters, Chikitsa Sthan 40 chapters, Kalpasthan 8 chapters, and Uttar Tantra 66 chapters. Next slide. Importance of blood, that is Rakta. Sushruta has considered Rakta as fourth dose as it is very important in surgical practices in day-to-day life too. He has mentioned in Sutra's San Adhyay 4th, fourth blood as base of living beings. Life depends on blood, so one should protect blood in order to protect life. Blood is important factor in today's surgical practices regarding hemorrhage, hemostasis, and rather all things. Next slide, please. Blood and its preservation is suggested in today's practice. Excessive loss of blood can lead to death. Hemostasis is an important stage in every surgical case. Surgeons should check for need of transfusion. Excessive loss of blood may lead to hypovolemic shock and further complications like death. Next slide, please. Preventive measures. As blood is an important factor of life, there are several measures by which we can prevent its loss and secure one's life. Limited loss of blood is considered as best in every surgery. To avoid hemorrhage, BT transfusion measures are taken before surgery. It prevents hypovolemic shock and other life-threatening conditions. Next slide, please. Hemorrhage, which is also known as Raktasrava. Hemorrhage is a condition in which there is excessive loss of blood during an operate. It can be arterial, venous, capillary bleeding on nature of vessels. It can be acute bleeding or chronic bleeding depending upon duration. It can be external bleeding or internal bleeding. Mild hemorrhage is considered about 500 ml of blood loss. Moderate is considered as 500 to 1000 ml of blood loss, and severe hemorrhage is considered when blood loss is more than 1000 ml. Management of hemorrhage. There are several measures that we can take to manage hemorrhage, among which blood transfusion is first measure, pressure and packing, and tourniquets, that is tying the objects, positions against gravity, bone wax, cauterization, Lodra Churna Prayog, Pralek, Shar, Agni, Shital Parishik. These are all included in Sushrut Samhita. Next slide, please, sir. Blood transfusion, that is Rakta Danam. It is a life-saving procedure. It saves one's life from shock and other life-threatening conditions. Donor selection is important. History, clinical examination, lab clearance is mandatory. Blood grouping and compatible testing should be done before transfusion. It is done under all aseptic precautions. Next slide, please, sir. Principles of blood administration. There are several principles at which it should only done when necessary. Only needed components should be given. Indication should be clearly stated. Counseling and consent should be taken. Strictly asepsis should be maintained. Then doubly checked name, age, hospital, etc. Details should be checked twice and thrice before transfusion. Pre-transfusion vital signs monitoring should be done. Next slide, please, sir. Hemostasis. Hemostasis is an important step in surgical practices. Hemostasis is preservation of blood loss. It is followed by several mechanisms. First, vascular spasm. Second, platelet plug formation. Third, blood coagulation. And last one, fibrosis. Blood clot begin to develop in 15 to 20 seconds. After 20 minutes to 1 hour, vessel get completely closed. Next slide, please. Highlight. Acharya Shushruता's importance, Shushruta Samhita's importance, Rakta Mahatva, Rakta Strav, that is hemorrhage, Rakta Danam, that is blood transfusion, and hemostasis. Thank you.
Thank you, doctor. Next, I invite Dr. Apurva Rajkumar for the presentation. I invite Dr. Apurva.
Good evening, ma'am.
Doctor. Doctor, you are audible.
Yes.
Please share the screen.
Hello.
Yes, doctor, you are audible.
Yes, ma'am. Screen share करो, ma'am.
Okay, doctor.
Dr. Apurva. Hello, Dr. Apurva.
Hello.
Doctor, can you share the screen, doctor?
Yes.
Dr. Apurva.
Hello, Dr. Apurva. Hello, Dr. Apurva, can you hear me? Hello, Dr. Apurva, can you hear me?
Dr. Apurva, please unmute.
Hello, Dr. Apurva, can you hear me?
Yes,
Okay,
doctor.
doctor, your
Your
screen
is visible.
doctor.
Hello.
It's visible, doctor.
You are audible, doctor.
Good evening, sir. My name is Dr. Apurva Rajkumar Badone. My topic name is Ayurvedic Review of Rutucharya. My guide name is Professor Dipak Kumar Parida. Next slide. Introduction. The basic principle followed in the Ayurvedic system of medicine is Swasthasya Swastha Rakshanam, which means to maintain the health of the healthy rather than the Aturasya Vikara Prashrama, means to cure the disease of the disease. For the purpose, the Dinacharya and Rutucharya have been mentioned in the classes of Ayurveda. Rutucharya in Ayurveda, Rutu means seasons and Charya means routine. Therefore, Ritucharya means the list of activities which are meant to be done as well as those activities which are meant to be avoided in the various seasons. There are a total 6 seasons according to Ayurveda in 1 year. The body needs to adapt itself according to this seasonal variation to remain the healthy, fit and disease free. It's because of the body. Every person is unique according to Ayurveda in terms of their prakrutis and dosha effect. Ayurvedic prescribe some rules in regard to diet, behavior and ritucharya to preserve the dosha's balance as the season change. Rutucharya. Rutu means seasons and Charya means following the discipline. The term Rutucharya is the routine that is to be followed during 6 different seasons. In short, we can say that Rutucharya describes the season regimens according to Charak Samhita. 1 year consists of 6 Rutus, in which 3 Rutus like Shishir Rutu, Vansat Rutu and Grishma Rutu comes under the Adan Kal. That is Uttarayan and Varsha Rutu, Sharad Rutu and Hemant Rutu in Visakha Kala, that is Dakshinayan. Next, Ritu and required Panchakarma are Shishur Rutu required Svedan, Patar Potli, Shashti Shali, Pinda Svedan, Abhyanga, Vasant Rutu required Vaman, Grishma Rutu required Mail Abhyanga and Svedan, Varsha Rutu required Vasti Karma, Sharad Rutu required Virachan Karma, and Hemant Rutu required Virachan Abhyanga and Svedan. Hemant Rutu, effect of a Hemant Rutu and Shishir Rutu on body. Jataragni get agitated and appetite increase. Due to this capacity, body easily digests Guru Ahar as this lies in Dakshinayan phase. Hence, body growth due to the increased appetite. Heavy food is not consumed accordingly. Then this increased metabolism of body start consuming body dhatus, therefore leading to the weakness to the body. Next, lifestyle to lead in Hemant Rutu and Shishir Rutu. Food rich in Madhur, Amla and Lavana Rasa should be consumed to satisfy body's metabolism. Snigdha food should be consumed. People should exercise regularly. Person should resist in a warm and cozy place and should not directly be exposed to outer cloud environment. Diet: people who are non-vegetarian should eat meat probability of udak like fish and tortoise, anup like ox and goat, which help provide good energy. Next,
Vasant Rutu. This season is commonly known as a springing season in common language. In this season, breeze flows from south to north direction. So sun is hot. Sun is not having intense heat. Hence, sun appetite reddish in color. New leaves organized from trees. According to modern day calendar, is fall in the season is March and April. Next. Lifestyle. The person should exercise regularly during this season. Sleeping in daytime is strictly avoided in this Rutu. Body should regularly be cleaned by following Panchakarma procedures like Tikshna Vaman, Tikshna Dhupanpan, Tikshna Gandush, Tikshna Nasya. One should bath regularly and should apply some natural fragrance on body. Avoid exposure to direct air. Oil massage should be done. Chandan and agaru should be applied on body. Next. Diet. Honey should be consumed daily as it helps in avoiding disease caused by kapha. Yava should be taken in Vasant Rutu. Godum should be taken. Asav, Shidu, Mardik, Madhav and Arishta should be consumed in the regular basis. Shunti, Nagarmoto should be boiled in water and then should be consumed with honey. All cold stuff should be avoided. Snigdha and Katu Rasatmak food stuff should be avoided. Stuff that contain Madhur and Amla should be avoided. Next. Grishma Rutu. In this season, commonly known as a summer season, sun is hot and penetrating sun heat is maximum. Environment is hot and sky remains clear. Atmosphere is bright and hot. Wind is directly north and west direction. Air is dry, light and hot. Moonlight is pleasant. Effect of moon is negligible. Land become hot and dry, especially during daytime. Water become hot and light. Very little water in river. Next. Lifestyle. Avoid exercise. Should take arrangement to cool. Keep oneself cool. Should be avoid outside work during daytime to keep yourself cool. Apply a mixture of chandan and kapur on body to protect oneself from heat. Avoid sexual intercourse every day. Diet to wear soft, light color and thin cloth made by cotton. Next, diet to use. Avoid to use of Katu and Amla Lavan ras and a product containing these rasas. Drinking of alcohol should be avoided. Consume plenty and fluid which helps in resist a loss of fluid of the body by sweat. Consume draksha, nariyal should be consumed with water. Avoid heavy food and oily food. Start taking daily dairy products. Next, Varsha Rutu. In this season, Varun and Vayu to be Vayu started flowing in this. This is very essential for the agriculture purpose. Rivers are flooded with water. Lotus flower bloom in rainy season. In this season, the Dattatray is manda and appetite it decreases. Next. Lifestyle. Should protect yourself from getting wet in a rainy season. Prasangane Udvartanam Snehanandum Panam should be regularly done. Apply aguru on body. Next. Diet. Avoid heavy and spicy oily food. Avoid water directly from well. Old rice and above should be consumed with krutayush. Should avoid consumption of alcohol. In Varsha Rutu, one should take food full of amla and lavan rasa. Next, Ksharad Rutu. in Indian calendar, month for Sharad Rutu is Ashwin and Kartik. In this season, sky is filled with scanty white cloud. The sun is hot. The heat effect is normal. Air is damp and hot. Atmosphere is clear. Effect of moon is moderate. Land emanated water vapors remain the slightly wet, muddy, and covered with lush green grass. Water is clear and pure due to the ray of rising star Agasti. In this season, dominant rasa is Lavan. Next, lifestyle. One should avoid heavy food as Jatar Agni is moderated. One should apply Ushir on body and then sit in moonlight. Person should save himself from direct sunlight and Easter wind. Never sleep in daytime. Clothes should be loose and light color. Diet. Person should use Kashaya, Madhur and Tikta Rasa in this season. One should eat Fali rice, Gehu, Yava, Muga. Next, importance of Rutucharya. According to Acharya Charak, one who knows the suitable diet and regimens for every season and practice accordingly are enhance the strength and luster of the body. Concept of Rutu Sandhi. Last 7 days of present Rutu and the first day of the subsequent Rutu together is known as Rutu Sandhi. During the period of the Rutu Sandhi, the diet and regimen should be discontinued gradually, and regimens of subsequent Rutu should be gradually adopted. Next, ऋतु हरित की रसायन वर्षा ऋतु अनुपान सैंधव लवण, शरद में शकरा, हेमंत शुंठी, शशिर पिपली, वसंत मधु, ग्रीष्म गुड़. ऋतु विपर्य, when we get the unnatural and unaccepted season symptoms, that is the different symptoms in season, is called as a Rutu Viparya. Yamadrashta Sharandhar has mentioned that movement of the sun from one stellar constellation to other makes for the 6th season, during which Tridosha undergo accumulation, aggregation, and pacification. The last 8 days of Kartika and the first 8 days of Aghana is described as Yamadrashta Kala. During this period, it is advised to strictly follow the seasonal regime and should take small quantities of food. Next, Tridosha and Rutu. Vata dosha, Chay, Grishma, Prakop, Varsha, and Prasar Sharad, Pitta, Chay, Varsha, Prakop, Sharad, Prasar Hemant, Kafa, Chay, Shishira, Prakop, Vasanta, Prasar Grishma. Conclusion. Ayurveda greatly believe in the daily regimens, season regimens, that is lead to a healthy life. Concept related to the seasonal regimen mentioned in Ayurveda is very unique, as it aims at physically, mental, social, and spiritual well-being. Rutucharya has been described to maintain the health of the equilibrium of the 3 dosha, that is Vata, Pitta, Kapha, for this seasonal variation and for the prevention of the various diseases. Ayurveda emphasizes the importance of Ritucharya in this instrument in the prevention of disease and promotion of ideal health. Ayurveda life remedies are simple, non-invasive, non-traumatic, and generally do not interfere with other form of treatment. This is the complete daily routine which everyone should follow to lead a healthy lifestyle. Seasonal regimens which benefits and maintain in complete health, which is aim of Ayurveda. Thank you.
Thank you, Doctor. Next, I invite Dr. Rahul Sharma for the presentation.
Hello.
Hello, Doctor.
Yes, ma'am.
Doctor, please share and start.
Yes, ma'am, I'm sharing.
Screen is useful, Doctor. Please start, Doctor.
Yeah. Good evening, everyone. Myself, Dr. Rahul Sharma, first year PG scholar from the Department of Shalatantra, Sri Kalavareshwar Ayurvedic Medical College from Bangalore. And I am presenting the topic Rakta Mokshana with special importance to Sharaveda, guided by Dr. Shetasai, Professor, Department of Shalatantra and Sri Kalavareshwar Ayurvedic Medical College. The contents are introduction, Rakta Chaturtha Dosha, importance of Rakta Mokshana, types of Rakta Mokshana, Sharaveda, importance of Sharaveda, contraindication and indication, Sharaveda, Vidhi, and discussion and conclusion. The introduction, Rakta Mokshana is one of the parasurgical procedure. It is one among the Shodhana Karma according to Acharya Churukta and Acharya Vagbhata. Acharya Charaka has also mentioned the procedure Rakta Mokshana but did not consider it under Panchakarma. The process of Rakta Mokshana can be traced back to the Vedic period only, not beyond that. In the Kaushika Sutra of the Atharva Veda, reference of bloodletting, Rakta Mokshana by leech are available. The Rakta Mokshana is one of the important procedures carried out in various Shalatantra Vyadhis. Derivation. The word Rakta Mokshana comprises of two words, which means Rakta and Mokshana. Rakta means blood. Mokshana derived from the root moksha means to relieve or to let out. Therefore, letting out blood is known as Rakta Mokshana. Synonyms. Avasechana, Rakta Nehana, Rakta Visravana, Shonita Mokshana. Rakta Chaturtha Dosha. Tadevirev Shonita Chaturthe Samuvasti Praleshwatirihi Sariram Bhavati. The three doshas along with the Shonita, the fourth, are considered the cause of the origin, the existence and the destruction of the body. The reference is taken from Shrutaka Samhita Suprasthana, 21st chapter, 3rd sloka. Next, the reference is taken from Shushruta Sutra, 21st chapter, 4th sloka. Dharate deha kapadasti na pittan na cha marutat shonitadapi va nityam deha etatastu dharyet. The body never exists without kapha, pitta, maruta and also shonita. These are necessary to sustain the individual. The next reference is taken from the same chapter, 21st chapter, Sutrasthana, 28th sloka. Evam dosha kadachidek pasho Dvishe Namastra Shonita Sahita va Anekada Prasaranti. Dosha prasara happens either individually in combination of two or three doshas or in combination with Shonita. While explaining the importance of Rakta, Acharya Sushruta has mentioned in Sushruta Sutrasthana 14 chapter 44 sloka that the Rakta is the root for body and does nourishment of it. It is said to be the life of body, so it should be protected. Then in Charaka Samhita Chikitasthana 5th chapter 27th and 28th shloka, it is explained by Charaka that when Kapha and Pitta or Shonita are vitiated while Vata is under control, then respective Kriya has to be done by treating the aggravated dosha such as Kapha, Pitta and Shonita. Apo Vate Jit Pre Pittam Shonitameva Yadi Kopyate Va Dasya Kriyamena Chikitsate Yato Ulbane Dosasya Tatra Karye Vishajjitam. Rakta Mokshana. Raktasya Mokshanam Rakta Mokshanam. Letting out blood for therapeutic use. Importance of Rakta Mokshana. The reference is from Shushruta Sutra 14 chapter 34 sloka. Rab dosho grantaya sopa roga shonita jasaye Rakta Mokshana silanam na bhavanti kadachana. Person who undergo Rakta Mokshana will not suffer from any kind of sub dosha, granthi, shofa, roga due to dushta rakta. Raktamokshanas are majorly classified two types, Shastra and Ashastra. Again, Shastra is classified as Prachanna and Shiraveda, and Ashastra is classified as Jaloka, Shringa, and Alabu. Shastra Raktamokshana, Prachanna. Prachanna is multiple pricks are made in a specific manner till there is appearance of blood, indicated when vitiated rakta is vicious or localized, or the vitiated dosha is balwan. Shiraveda, puncturing a vein of therapeutic purpose, indicated vicious of all doshas pervading the entire body, or the doshas at balwan. Shringa Acharana, bloodletting using cow horn, blood vitiated by Vayu and Pitta, indicated when localized in skin area, Sukumara. Shringa properties are, its Virya is Ushna, Rasa is Madura, Guna is Snigdha, Doshagna is Vata, Jaloka Acharana, bloodletting using Jaloka for therapeutic purpose, in the case of Pitta doshas and for Param Sukumaras. Alabu Avcharna, blood vitiated by Kapha and Vata dosha, indicated when localized in scale area, Sukumaras. Properties of Alabus are, it is Kattu in Rasa. Doshagna is, it takes Kapha out from the body. Gunas are Ruksha and Tikshna. Shiraveda, puncturing a vein for therapeutic purpose. Importance of Shiraveda. Among all the treatment method of Sadhya Rogas, Shiraveda is the best, just like how the paddy and the other crops die out completely by removing the burns of the field. This procedure helps to eliminate the diseases completely. This is explained in Ashtang Sangra Sutra Sthana 36th chapter and 2nd shloka. When other treatments fail, Shiraveda has to be done for Rakta Prakopoja Vikaras, explained in Ashtang Sangra Sutra Sthana 36th chapter. In Shushruta Sarira, 8th chapter, 22 shloka, Sneha Adivihi Kriya Yogne, Tatha Lepnay Rapihi, Yatnayaso Vyadaha, Santi, Tatha Samyak Siravedat. The condition which do not subside with Snehana, Lepa, etc., those conditions will subside with proper Shiraveda. Rakta is the Adhisthana for all the Vikaras. There is no other dusha like Rakta, and Shiraveda is the first important procedure explained in Ashtanga Sangra Sutra Sthana 36th chapter. In Sushruta Samhita Sharirasthana 8th chapter 23rd shloka, Shiraveda is considered as the Ardha Chikitsa in the Shalya Tantra. Shira Vyadis Chikitsardha Shalya Tantra Prakrititaha. Contraindication of Shiraveda. Ata Vishravya Shavaranga Shopa Shinasya Chala Alambu Bhojanam Itihi Pandu Roga Asha Odara Shoshira Garbini Cha Savayatava. Sushruta Sutra Sthana 14th chapter 24 shloka. Individuals with Sarvanga Shopa Shina because of Amla Rasa Pradhana Bhojana, persons with Pandu, Arshas, Udara, Shosha and Garbini. According to Sushruta Sharirasthana 8th chapter 3rd shloka, Shiraveda should not be done in following persons like Bala, Stavira, Ruksha, Shatakshina person, Biru, as in Biru, because as there will be Tambula Hata, they will faint by seeing the blood. Tired persons, Madhyapana, alcoholics, and then the emaciated person resulted of long journey or sexual intercourse. Mamita, Virikta, Ashtapita, Jagarita, Anuvasita, Kliba, Krishna, Garbini, Kasa, Swasha, Akshepaka, Vata, Pakshagata. Those doing Upavasa and those who are afflicted with Pipasa and Murcha. Those veins which are prohibited from puncturing, which are invisible through indicated for puncturing, which are visible but not controlled from moving apart, which are not raised, engrossed by pressure from the tourniquet, etc. Though controlled, such veins should not be punctured. Shiraveda should not be done for those who are below 16 or above 70 years of age, according to Vagbhata. Indications of Shiraveda. Vidradi, all 5 types of Vidradi except Tridoshaja, Pataja, Saruja Kushta, Shofa, Palyayama, Shalipada, Visajushta Shonita, Arbuda, Visharpa, Granthi, Stanaroga, Vidrika, Shudra Rogas, and etc. These indications are explained in Sushruta Sutra, 25th chapter, 12th and 16th shloka. Few more conditions added by Vagbhata, like the Vyadhi which arises out of Pitta and Kapha diseases, which don't respond to Shita Ushna. Snigdha Ruksha Chikitsa should be understood as being born from Dushta Rakta, and Rakta Mukta should be performed. Kala Maryada for Shiraveda. It is explained in Sushruta Sharira 8 chapter 7 shloka that Shiraveda should not be performed in extreme cold, extreme hot, windy and cloudy day. It is prohibited in healthy individuals. In Sushruta Samhita Sharira Sthana 8 chapter 7 10th shloka, it is explained that in Varsha Ritu, when the sky is clear, Shiraveda can be done. The Grishma Ritu, when it is cool, Shiraveda will be done. In Hemant Ritu during afternoon. Instruments used for Shiraveda are Putarika, Vrehimuka, Ara, Patra, Suchi. Vedana Pramana. In Sushruta Sharira 8 chapter 9 shloka, Mamsala area which is fleshy, 1 yava size with Vrehimuka Shastra. In other areas, half yava size or to the depth of the Vrihi seed. Over bony areas, half yava depth with Putarika Shastras. Site of Shiravedas. Vata Shonit, in the case of Vata Shonita, Padari, Padada, Avabahuka, Chippa, Visarpa, Vata Kantaka, Vicharchika, and the site is 2 angula above the Shipra Marma. Shiraveda should be done. First Shishaka, Kanja, Panga, Vata Vedana, 4 angula above Gulfa Sandhi, the Shiraveda should be done. In the case of Gyudrasi, 4 angula either above or below Janu Sandhi, Shiraveda should be done. In case of Viswachi, 4 angula either above or below Kurpura Sandhi, Shiraveda should be done. Apache, 2 angula above
me, Dr. Rahul.
Basti Marma should be done. Kalaganda.
Dr. Rahul, you are exceeding your time limit.
Okay, ma'am, I'm close to the conclusion. As you can see, in this chart, I have mentioned all the diseases on the sides. Consideration before Rakta Moksha. Inform the patient about the procedure. Take the consent. Investigation, as mentioned in the PPT. Advised to stop stimulating medicine 2 or 7 days before the procedure. Patient is advised to have food before the procedure, and the aseptic precaution to be taken. Material required for the procedure should be kept ready. Purv karma others snehana, vedna, and the yavagupana to be done. Patient to be made sit comfortably. Purv karma, Taila for Abhyanga, Nadi Sweda, cotton, swab, and gauze pieces to be kept ready with bandage roll, tourniquets, scalp pen number 16, 18, 20 can be used. Kidney tray should be kept ready. Pradhana karma, tourniquet should be tied and the suitable vein prominent vein should be selected and it's to be punctured, and the blood is allowed to flow out till it stops on its own or unless the patient feels discomfort. As in the pictures, you can see the Sthanik Abhyanga and Shiraveda to be done. Paschat karma, after this the needle is removed and bandage is applied over the sides. Rakta Moksha Pramana, 1 prastha approximately equal to 640 ml is the Uttama Matra. Explained in Sushruta Sharira 8 chapter 16 shloka. This is a probable mode of action. In the case of Shiravanti, a mode of action like Shiraveda removes the Dushta Rakta, normal Vata Granthi restored. Vyana Vatu carries Shuddha Rasa Rakta to truck, regeneration of the tissues, and Shamana of the Vyadhis happen. Samyak Vidya Lakshana is explained in Sushruta Sharira 8 chapter 11 shloka. Well and successful Vidya Sera bleeds in stream and spontaneously stop after Muhurta. These are the features I mentioned in the PPT of the Shuddha Lakshanas. Hina Vidya Lakshanas are Durdina, Durvidya, Sitavataya, Ashwinne, Bhukta Matre. In Vidya Lakshanas are explained in Shuddha Sutra 14 chapter 19 shloka like Shoka, Kandu, Raga, Daha, Paka, Vedana. Then Atisarakta, Atirakta Shrava Karanas may be due to which is done in Ushna Kala, Shvedana, Dipak, as I mentioned earlier in the contraindications. Atyoga Chikitsa, I have mentioned like Bandhana, powder of Lodra, Madhuka, Priyangu, Patana can be done. Bandhana should be done. Bleeding is not stopped, then Agni Karma can be done. Decoction of the Kapala Digana can be done. Raktastamak upayas like Sandana, Skandana, Pachana, and Dana should be done. These are the complications like blow vein, infection, thromboconverted, and shock. Discussion Dr. Moksha is an effective procedure in various conditions like in Vishnavana. It helps in quicker healing by improving blood circulation. In Saraganti, it relieves symptoms like pain, burning sensation, itching, pigmentation by removing traces of the vitiated blood. For localized conditions, Dr. Moksha can be done by Prachanna, Jalopa, Chiranga, and Alapu, where Sharavada is said to be Sevanga Doshini. Conclusion, Rakta is the entity as important as the dosha. Rakta Mokshana is the type of shodhana concerned with the removal of the doshit Rakta. Rakta Mokshana is indicated in various Shalya Tantra Vyadis like Dushta Varana, Vanashvaka Granthi, Asha, Sasikta. It is explained in Shuddha Sutra 14 of the 34 sloka. In people who undergo Rakta Mokshana for dosha Granthi Shoka and the rogas due to Dushta Rakta will not occur. Thank you.
Thank you, Dr. Rahul. Next, I invite Dr. Monali Khanashyam for the presentation. I invite Dr. Monali.
Am I audible, ma'am?
Yes, doctor, you are audible.
Please can share my PPT, ma'am.
Okay, doctor.
Good evening, everyone. Am I audible, ma'am?
Yes, doctor. Please start.
Good evening, everyone. Myself, Monali Ghanshyam Khune, second year MD student of Kumar Vitta Department of SMBT Ayurved College, Nashik. My paper presentation topic is a Karsha critical review on nutritional deficiency as per Ayurveda, under the guidance of PJ Suryavanshi, sir. Next slide, please. Abstract. Ayurveda is mainly based on preventive aspect first rather than curative. Ayurveda believes that many health problems can be prevented through the nutritional diet. Food is important as nutritional source, also therapeutic importance. Karsha is disease similar to undernutrition. A protein in previous slide, ma'am. Protein energy malnutrition is one of the diseases related to annavasrotas. It is a type of malnutrition resulting from deficiency of proteins and calories in food over a long period of time. It is very common among young children, usually below 5 years. Protein energy malnutrition is not only important cause of childhood morbidity and mortality, but also leads to permanent impairment of physical and possibly of mental growth of these who survive. Diseases such as Parigarbhika, Fakka, Balashoshi, and Karsha, described by various authors of Ayurveda, can also correlate to malnutrition based on clinical features. These diseases are related to each other. This article highlights the Ayurvedic view of the nutritional disorder like protein energy malnutrition. Next slide, please. Introduction. Under the nutrition is the condition in which there is inadequate consumption, poor absorption, or excessive loss of nutrients. Sometimes malnutrition and protein energy malnutrition are used interchangeably with undernutrition. The term protein energy malnutrition applies to the group of related disorders that include marasmus and kwashiorkor. This affects the child at the most crucial period of time of development, which can lead to permanent impairment of later life. The protein energy malnutrition is measured in terms of underweight, low weight for age, stunting, low height for age, and wasting, low weight for height. The food. The ahar is one of the three sub-pillars of the life as per Ayurvedic classics. The transforming unit from food into nutritional is termed as Agni or digestive fire, which forms a edifice upon which the Ayurvedic system is built. The Ayurvedic, according to Acharya Charak, over the lean, Atikrusha, person who is described under the eight despicable persons. Ashtanindit Purush. Next slide. Aims and objective: to study the Karsha, to study the protein energy malnutrition under the Ayurvedic aspect. Next. Etiology of Karsha and malnutrition in Ayurveda. In Ayurveda, it is mentioned that Ruksha Annapan Sevan indulge in rough food and drinks, Langhan, fasting, Pramitashan, little diet, excessive sub-injections to evacuation therapy, Shoka, Chinta, Bhay, Shram, excessive physical and mental activity, excess non-uncutance inviting to the person, Prakruti, constipation, constitution, Bija dosha, hereditary, Zwar, old age, Vikar, Anushay, continuous disorder, and Krodha, anger make a person lean. Sign and symptoms of Karsha. The lean person has the shushka, speak, udar, and griva, dried up buttocks, abdomen, and neck. Dhamni, jala, santata, a prominent vascular network, Twagasti Shosha, Atikrusha, permanent remanent of skin and bones, Sulapurvas, thick joint, Vyam, oversaturation, does not tolerate height, intoxicity of hunger, thirst, disease, and drugs. Karsha Samprapti, pathogenesis of disease, receive etiological factor, diet and physical work, Nidan Sevan, Vatvardhak Ahar Vihar, vitation of Vat, then Agni Dusti, formation of arm, Dhatu Shushka, Dhatu Shay, inadequate rust Dhatu, and improper absorption due to formation of Samaha Shoshita Rasadhatu, malformation of Rasadhatu, undernourished Rasadhatu circulate in whole body, alpa portion of Dhatu causes Karsha. Malnutrition described in Ayurveda. There are 4 diseases described in different Sahitas of Ayurveda that are near to malnutrition as mentioned in modern medicine. Karsha. Karsha is undernutrition condition due to reduced food intake of baby resulting from less intake. If mother use Vatavardhak Ahar Vihar, baby take Vata Dushtisanya, ultimately baby become malnourished. Balashosha. The causes of Balashosha Arochak reduced digestive capacity, Pratishay, running nose, Zwara, fever, cough, and at last the baby leads the Shosha, emaciation. Parigarbhika. If any baby is on breast milk of pregnant woman, then Parigarmika rog can occur, and that milk have poor nutrient. Sign and symptoms of Parigarbhika roga are cough, impaired digestive capacity, vomiting, fever, and anorexia. Fakka roga. In Fakka, Shiras Fakka, Garbhas Fakka, and Vadis Fakka are described. Shiras Fakka is due to intake of Shleshmic Dugdha. Vadis Fakka is malnutrition condition resulting of any disease of Graha Roga, etc. Garbhas Fakka is due to feeding of baby by pregnant lady. Sign and symptoms of Fakka Roga are wasting of buttocks, upper limbs and thighs, pot belly, abdomen, head appears big due to relatively wasting in body parts, and baby is unable to walk. Next. Diagnostic criteria, Indian Academy of Pediatrics, classification of malnutrition. This classification is based on weight for age values, weight for age percentage, grades, 100 to 80% normal nutritional status, 79 to 70% grade 1 malnutrition, 69 to 60% grade 2 moderate malnutrition, 56 to 50 grade 3 severe malnutrition, less than 50 grade 4 very severe malnutrition. Weight for age is an indicator for total malnutrition. Underweight. Weight for age percent equals to current weight of the child in kg multiplied by 100 divided by expected weight of the child for that age. Next discussion. The Karsha is nutritional disorder described in Ayurveda Sahita and it is possible related to the malnutrition. According to Acharya Charak, Ati Karsha person are described under the Ashtanindita 8 discapable person in Ayurveda. No much described is found regarding Karsha, especially in children. Karsha, Balashosha, Parikarabika, Fakkaroga are the diseases described in Ayurveda text. Is related to each other and possibly correlate to protein energy malnutrition. Alpashan, Vishamashan, Vihar dosh like Atishrama and Mansik bhav like Shoka, Bhaya, Krodha are the main etiological factors for Karsha. The Samprapti of Karsha is like this Nidana Sevan, Vata Prakopa, Shoshita Sadhatu, all Dhatu Trupti, Alpa Karsha. Utpatti. It is a management is done by Sannapan and Bruhan. Sapatarpan and Bruhan. Next. Conclusion. Malnutrition is described in modern medical science but is similar to nutritional disorder in Ayurveda, like Karsha, Fakka, Parigarbhika and Balshosh. A systematic study of this condition provides insight into hazards of nutritional deficiency and represent different aspects of nutritional deficiency, and proper understanding of pathogenesis of condition provide valuable key for the effective management. Thank you.
Thank you, doctor. So now I invite Dr. Nidhi. I invite Dr. Nidhi RB. Dr. Nidhi. So next I invite Dr. Needu Singh.
Next, I would like to invite Dr. Shreya Soni. Dr. Shreya Soni, are you there? Okay, I think today's presentation seems to be over. Let's find Dr. Aishita.
Yes, doctor. So it seems to be over today's presentations. So before winding up, I congratulate our participants for presenting different topics and the active participation. Thank you all. And finally, let me express my gratitude towards our respected faculty members for being there with us. And thank you all. We'll meet tomorrow. Good night.